pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'd like to thank everybody for being here today.
Good morning, Mr. Chair.
Good morning, Mr. Chair.
Could I get approval of the county board?
So moved.
Second.
Got a motion by Commissioner Winchard, seconded by Commissioner Johnson. All in favor signify by saying aye.
Aye.
Okay.
Opposed?
Approved. Yeah, opposed. I lost my memory bank. Do we have any additions or deletions to the agenda?
So moved, Mr. Chair.
Got a motion by Commissioner Johnson.
Second.
Seconded by Commissioner Lemire. All in favor signify by saying aye.
Aye.
Opposed, motion carries. Okay, Catherine, Farm Family of the Year. Farm Family of the Year. Yes, Emily.
I think we should have the Cody,
think so.
Cody and Roxanne come up here too.
I think Clint.
Yeah, what,
Or Clint.
Clint.
yeah.
Yeah.
I think
All right.
Clint.
So
We'll get you.
we'll call you up. Oh, you're gonna come now.
They can come now.
Sure.
They can come now.
Yeah, so we're here this morning just to honor our Morrison County Farm Family of the Year. And if you're unfamiliar, farm families are chosen from each county in Minnesota each year by their local extension committees. And families are selected based on their demonstrated commitment to enhancing and supporting Minnesota agriculture. So we typically look for farms that are active, do a wonderful job at what they're doing, but do more than that. So involved in the community, are helping others, and contribute to the greater good of the county. And so this year, the Catherine family was selected as the Morrison County Farm Family of the Year. They were honored at Farm Fest the first week of August in Redwood Falls. And I'm just going to read a few little things about the Catherine family and then ask the commissioners for any comments they may have as well. So the Catherines currently raise 45 registered Charolais and commercial cows, so they're very active in the beef industry in the county and throughout the state. They basically raise all of the animals' feed on their land and rented land. And in 2012, the Catherine Charolais herd became a cooperator herd of Leachman cattle in Colorado. Clint and Roxanne have two daughters, Kaylee and Kendra. Clint has served as Morrison County Fair Board president for the past 8 years, and Roxanne has been fair manager for 3. Clint is the current president of the Minnesota-Wisconsin Charolais Association and is a past director with the Mississippi Valley Cattlemen. Roxanne is the Mississippi Valley Princess Coordinator and volunteers with various 4-H and FFA activities. And that's just a few of the many, many things that they do. So I fortunately have had the opportunity to work with them personally with some of the beef programming that I do in the county. And I can say I was very excited when they were chosen as the farm family. They very much deserve it. I mean, as you can see from just this very short snippet I read, there's a lot more. They're very involved and we think very deserving of this award. So I'd ask commissioners if you have any additional comments or anything you'd like to share as well.
Well, I think we need our guests of honor
Yeah.
to come up.
Yeah.
Sorry, guys.
I thought they were coming.
If I may, cause see, sitting back there, we can't get you on camera.
You've seen me already.
When you're up here, we get you spotlighted.
We'd like to see you.
And I know the Catherines have been involved in the fair for years, so they do a
Take a
lot out
chair.
there.
Make
so-
yourself at home.
Yeah.
We gonna be here that long?
Well, why not? You know, Clint, you've sat in that chair before, but Roxy doesn't get to come here very often.
We could change that.
Yeah, exactly.
I just wanted to make a point, Mr. Chair. Emily said about active. Here's about your most active farm family that you got. I mean, they're just so involved in the community. And as a county commissioner and a resident, I appreciate what you guys do at the fair board and everything. It's just tremendous, you know. And then again, I was out at their farm. They got a really nice run farm out there, very well kept up. It's something for the county to be proud of.
Thank you.
Mr. Chair?
Yep.
Being on the Egg Society, serving on the Fair Board, it's amazing what that person has done, not to say what that person has done. I like to point the finger at Clint and say, yeah, Clint, you get the credit, but you know where the work is done. You know who does the work, buddy.
Yeah.
Roxy does, and quite honestly, there is not a doubt in my mind that the Morrison County Fair would not be the Morrison County Fair it is today without the two of you. that speaks volumes over and over and over again. There's always gonna be a naysayer out there, no matter what we do, no matter what you do. But the goods outweigh the bads over and over and over. And what has been done to that Morrison County Fair under, quite honestly, your direction. Let's face the music, put it where it is. Under your direction has just been something that the county should certainly and continue to be extremely proud of. And I really mean it. I thank you all very much for that. And I congratulate you on being Farm Family of the Year. Thank you very much.
Thank you.
Thank you.
Isn't it the old
You
saying?
You pull him through again.
That's my job.
Isn't that how it says, behind every good woman, there's a good man, I think? Or is it?
Backwards.
Just thank you for all the work you guys
Yep.
do with everything you do. People don't realize all the work that it takes to make things happen, and they don't just happen. There's somebody behind the scenes all the time, and you folks have done a wonderful job with that, so I thank you much.
Very humble.
Yes. Can you tell us a little bit about the experience at Redwood Falls?
Um,
I have no idea.
It's kind of interesting. Of course, you know, there's a family from every county. So you sit there and it goes alphabetical order from each county, so you got to see most of them, and then you get your picture. We went back and we missed a few of them, but I think the thing that was most interesting to me was you get in some of the urban counties, you know, more metropolitan. You see a lot more of their farm families of the year, like organic gardeners or like people that maybe just have a few chickens and they're doing something organic with it or whatever. And them were the people that were chosen for their farm family, and you kind of forget about them things a little bit, and it kind of reminded you our new era and where we're at, and some of the things that are just as important in agriculture that you wouldn't probably think of in certain sectors, certain counties. That's big for them, you know. So that was kind of the most interesting thing, I thought. Just kind of reminded you of something that you don't think about.
You even see that with the fair, with the agriculture,
Yep.
with, when people have the chickens and the rabbits, and it's not all the cows and
Yep.
the big stuff, it's a lot of these smaller farms that have the little stuff, so.
Yep.
Yeah, that does, it's amazing how things change.
And then, you know, of course, us, both of us, me, myself, I know a ton of people, and it was kind of nice to see there was 5 or 6 other counties, people that I knew that were farm families this year, so
Good.
you'll kind of remember that,
Yeah.
me personally, so thought that was kind of cool.
Yep, yep, very neat, very neat.
Well, good. We thank you very much
Yep.
for
And
that.
again,
Thank you for all you do.
congratulations.
Yep, absolutely.
Thank you.
I believe we wanted a picture, if we could do that now, or.
Yeah, we don't turn down
Oh, yeah, I was
pictures.
We
gonna
don't
say
do
elected
that.
officials
Yeah.
were good.
That's what everybody
all
goes,
of them we
what do you
want."
gotta go to the commissioner's thing for? And I said, photo op.
You guys wanna go right behind?
Slide together.
Maybe we should let them sit.
We're gonna stay sitting.
Yes.
Let's let them sit in the front.
No, you guys
No,
just
you
sit.
sit,
No, no,
I'll
you
stand
don't-
behind you.
No, right here.
Go ahead.
Right here.
You got two.
Oh, boy, I'm real important now.
There you go. You are. This way we can squeeze in there better, especially me and you, Claire.
Yeah, especially me.
Oh, so I'm the only one
Yeah,
sitting?
you're the queen.
How about you sit too?
All right, I'll
Yes,
sit.
there you go, that would look
There
nice.
we go.
Ready?
Oh, hold on 1 second, I need JJ. Okay.
Perfect, thank you.
I have to.
If we're not there, is there time to make the picture?
Walt.
Yes, Dennis and Anime.
Dennis and Anime.
Yes,
Oh, yeah,
yes.
no, for sure.
Oh, really?
Yeah.
Yeah, yeah,
Oh, yeah.
that's my mom and dad.
You look like your mom.
I've been told that.
Okay, okay. Thank you, Roxy. Thank you.
Thank you, guys.
ya.
Thanks, Clint.
Thanks, Glenn.
Thanks, Roxanne.
Okay, next we have Lake Chaminade Improvement District. Okay. Okay, let me see. Hi, Bob.
Morning, Bob.
Hello. And hello to you. I just wanted to say, before I start, is I want to thank Mike, and then Jeff filled in for Mike, one of our meetings. Deb, you came to one of our meetings, and I see Deb Lau isn't here this morning, but she's been to all of our meetings, and I really appreciate your attendance at those meetings to become aware of the issues that we're dealing with on Lake Shawano. And so I hope you've had some time to look at this proposed budget for 2018. My understanding is that's the primary focus of this session this morning.
And we do, Mr. Chair, need an actual vote to approve the budget and the assessment that comes along with that for 2018. So there is an actual action item with it, not just discussion. But I wanted
Yeah.
to make the board aware that our
If I may,
form
is there a time period on this? Is it, and we have to have?
by November, we really should be seeing all
So
of
my
this
question would
done.
be, do we have to take action today, or could we wait the next 2 weeks board
You
meeting?
could wait.
Okay.
Okay, if you would look, you all have a copy of the proposed budget.
Yep, going to
Okay,
start
and so look at the expenses first, and you can see that the first item is your Asian water milfoil control, planning, permitting, and projects related to that. We have to budget $12,000 for that this next year. And you can see number one is identified down there under budget notes. You know, we're going to have 3 pulls next year by scuba divers. And we've been able to do it on Chaminade by pulling. It's less invasive than using chemicals. And so we're going to try to stay with having divers pull and remove the plants for as long as we can. But there has been increasing growth, and so that's why the cost is going up there. Also, then that involved with that is cabin pontoon rental is $1,000. Then going to aquatic and vegetation surveys, we always have to have aquatic vegetation survey done, $2,500. That typically costs us. Hopefully it won't be any more than that in this next year. Under high water, no outlet study planning, permits, projects, for administration, engineering, legal, $20,000 we put in there to further our, complete our engineering and permitting kind of process, bringing us into the 429, Chapter 429 process, which is really a complicated process in order to move forward with the providing an outlet for our lake. There is no pumping yet, but hopefully sometime there will be. Then under water quality monitoring, $800. We do that every year. Aldery and I do the Citizens Lake Monitoring Program on our lake. We check water quality and such. In addition to that, it's going to cost us a little more because we're going to have to add assessing the water that's coming into our lake under County Road 203 and into our lake. Just runoff off that road that's coming in. And I checked with the DNR. They haven't been testing it. The watershed people haven't been testing it. Nobody's been testing it. So that's something we're going to take up this next year. We're planning on doing that. Public access cooperative projects, $3,000. Because we have Eurasian water milfoil in the lake, we want to, the last couple of years, we've purchased and built signs at our public accesses with pictures of the lake and where the aquatic invasive species are located on our lake. And so there's expenses there, but we also want to include a monitor on our lake, on each of these public accesses to invite people to, or inform them on how they should, their boat should look when it goes into the lake and how it should look when it comes out of the lake, pulling their plugs, cleaning the vegetation off the trailers and the boats and such. And liability insurance, $1,500. Administrative expenses, $600. Loan payment, $1,250. We have a loan. We've taken out a loan from the Lake Association 2 years now, and hopefully we can pay them back soon. Floating bog mitigation, because our water's going up, we're having more bogs uprooted, and floating around in our lake. And so far, we've been able to move them into areas that can use the vegetation, but we have that there as sort of a pot to cover that if we get some bigger ones. And then reserves 2,000. That comes to 56,400. If you look down at number 6, that would be the per parcel assessment rate is estimated to be $125 to $130 then per parcel.
If I may, Mr. Chair, Bob, what was
Yep.
it for last year? Remember?
Last year was 61 something, 6150.
6155.
So it's double.
Yeah, it's double.
And this is just on this 56,000?
Yes.
Mr. Chair, Bob, can I ask a question, if you don't
Sure.
mind? It was $61 last year,
Yes.
and it's $125, $130 this year.
Yes.
You came to that conclusion and that number how?
Well, by looking at our expenses.
Yep, and I get that, but how did you, who decided that that'd be okay? Was that through?
Oh, we had, at our annual meeting,
Okay.
we had a vote.
Okay.
And this one was approved. There was some no's, but very few no's
Okay.
for this
And,
one.
and who is able to vote at that meeting?
All the property owners that are there.
Okay?
And we had a big turnout this time.
And I would ask the question, what constitutes a property owner?
Well, all the riparian property owners and those that have easements to the lake or deeded access to the lake.
That, okay, that answered the question.
When-
Thank you.
When you
Thank
say,
you.
excuse me, but when you say deeded property to the lake, if there's an access and people they're not on the lake, but they have availability to the access, does that make them on the lake as far as
Yes.
one of your parcel numbers?
Yes.
Okay. The only reason I'm questioning that, we had some questions on a piece of property that people said they weren't notified.
Yes.
And,
I know.
and can you explain that?
Yeah,
I mean,
we heard that error, and that's the first time I knew about it. As far as I knew, everyone had been notified. We get all our mailings of the riparian property owners who deeded access from Joe Hay every year. And then when it comes to sending out notices to all of them, informing them of the meetings, we buy the mailing labels. So we get the mailing labels, and then we put them out and mail them. Evidently, the mailing labels weren't as complete as the list, and that's what shorted those. And I was surprised, and I'm disappointed, and I'm apologetic
Yeah.
that happened. But we also, followed through with all the other announcements to people. We have a Facebook site, we have a website, we posted it in the paper, like we usually do. And one other one, it's eluding me now, but, our association has a newsletter that we send out twice a year that's very informative to what I assumed was all the property owners that we were aware of. And so, I don't know, all I can do is apologize for that. I know it was.
They're listed
wasn't
on the
intentional.
list of assessments, so I don't know what happened. I mean, sometimes there's pieces of mail that gets lost, there's, who knows what.
well, but this one's pretty important. If they're ahead of the association and they don't get it for a bunch of people, that's a pretty
Yeah.
important
Yep.
one,
Nope,
not.
I agree, I don't know
Yeah.
why, but the name's there, so we'll make sure that that's included.
Okay,
I couldn't go further.
yep, go ahead, yeah, then we'll ask questions.
Let's see now, I'm trying to think, we went through that. Okay, so then the high water project, that's a separate situation. And this is an estimate of, for our high water project, the idea of that is to create an outlet for Lake Shamana. We do not have an outlet, we've never had an outlet, we've been considered a basin lake. And our water has elevated over the years. I think I've told you this before, that, it's up about 5.5, almost 6 feet higher than it was in 1970 when we moved on the lake. And over that time, basically, it was going up and down for many years. But the last 10 years, it's been going up and it hasn't been going down much each year. And now it's up over the high water mark for the last 5 years. And now it's 1.5 foot or more above the ordinary high water mark. Lots of people have had damage. We had a survey done last spring. I think I told you that before?
Yeah.
Okay, so I don't need to labor.
You're talking about going through some other land and lakes? to
Yes,
dra-
yes.
This is what you're talking about with this project,
Yes, that's right, yeah.
draining it into some other lakes and.
Yeah,
like-
draining into Lena Lake and then going under Highway 10 downstream to Crookneck Creek.
Okay.
Crookneck,
That
Fish
we
Trap
did,
Creek.
that we did
Fish
talk
Trap.
about.
Yeah,
Yeah, or we listened to.
yeah.
Yeah.
Okay, so that's what we're trying to do, and we've just completed a feasibility study that talks about that's a reasonable thing to do. But a feasibility study is just part of it. It's a conceptual plan. This is how it could go. And so the $20,000 that's up there is to help finish that, that study, and to deal with the permitting and the legal fees that's gonna cost us to go forward into
Mr. Chair,
this.
Bob, what was the cost of your feasibility study?
28,000, I mean, 28,000.
Was that funded with the general lid dollars last year?
That was, yes, that's why part of this loan from the association, 12.5, we used some of that for that. And part of our budget from last year, we had 10,000, I think, in it last year.
This is part of this.
Yeah.
Mr. Chair?
Yes.
Bob, I don't mean to be a fly in the ointment.
Yeah.
But this is just a study at this point in time. Once that study is complete, there has to be all kinds of permitting that needs to be done
Yes.
through the DNR, and there is
Yes.
nothing that says you're gonna get that permit.
No, well, there,
I'm just
yeah.
being upfront
We've
about it.
we've interacted, we've dealt with jurisdictions over this past year.
Yeah.
We've had meetings with all the jurisdictions, property owners, all the downstream property owners. This summer has been very busy, and we've had lots of large group meetings dealing with those issues. It doesn't say that we're gonna get it, but that's the process of going in. In fact, this week, we're working with more property owners, and the engineers are working with DNR. They'll be meeting more and more with the DNR. And so, you know, it doesn't say it's 100% it's gonna go that way, but I think it's more than 50% that it's gonna go, based on the damages that the lake is experiencing.
I'm not gonna pretend to say
Yeah.
that it's as easy as sticking a hose in your lake and sticking the other end of that hose in another lake, but essentially, that's what we're talking about, and then letting it go from wherever.
Yeah,
Pumping it out and pumping it in.
Mm-hmm.
I would anticipate that there's gotta be all kinds of different rules and regulations that are gonna fall into place here,
yeah.
that the DNR is gonna have control over, no matter what.
Yeah, well, the DNR, we have to deal with two counties too. We have to deal with our county, Todd County, townships.
Yeah.
And we've had meetings with them, general meetings, and they've alerted us to some of these hearings we have to have with those groups. We're aware of those. That's what
Okay.
part of this is all including.
Very good.
Yeah.
Thank you.
I guess I feel very positive about dealing with those downstream property owners. They were very receptive to our concerns.
Okay, very good.
Mr. Chair,
Thank you.
So,
Mr.
yeah.
what predicament would you be in if we approved this budget without that engineering fee in it?
Well, if you approved it without the engineering fee, the 20,000 in there, we'd be in a predicament. We wouldn't be able to pay for it. The engineers have, and so the attorney we retained have agreed to not accept any money until July of 2018. Because that's the time when the grant might be approved for us. We're looking at trying to get a 50% grant through the federal flood mitigation program, not the federal, the state, the DNR program through Pat Lynch's direction. And that's a very political thing, and we're working with our legislators to try to get that. And that would knock that thing in half if we could. If we get that, it's not a sure thing either. But those are efforts we're trying to make to reduce expenses to every one of us.
Bob, I'm a little confused, Mr. Chair, if I could.
Yep.
You have proposed 2018 and you have the 1.5 million in here,
It's just a suggestion, that's not.
but you can't collect that.
We're not
Okay.
collecting that. That is something
So
else.
we only can approve one budget and one assessment for the calendar of 2018, right?
See, this isn't, I'm not asking you to approve that.
Okay,
That water project special assessment, I'm not asking you to approve that. Just the 56.4.
okay, but
Yes.
when it says proposed 2018, I'm a little confused. And then
Yeah.
down in number 9, where you
Mhm.
say, if no grants or bonding are approved, the per parcel assessment rate is
Yeah.
estimated to be that. So that,
Yeah,
we're not
that's
talking.
confusing. I
Okay,
think that's
all
why I
right.
have the line there, just to, we can't, because we don't know if we're gonna get it. And if we can't get it from permanent, we aren't gonna have that kind of an expenditure for the engineers, because they'll be done.
Okay.
We won't have them.
Okay, so this is kind of what your proposed budget for 2018 is really contingent upon the work that's going to happen to determine whether or not you're grant eligible and permit eligible.
No.
Okay,
You see the first half of the page,
yep,
where there's that black line across it?
Yes.
That's the only one that we're asking you to approve.
no, yep, but the work that's done under that $20,000, when you talk about engineering, legal, pumping, operating expenses, the
Mhm.
administration, all of that, because you said you weren't gonna spend it all unless you get that grant. Like, let's say you don't get the grant and you don't get all the permits, you're not going to expense all of?
No, I didn't say that.
Oh, okay.
That's already been spent on your,
We spent
yeah, you've
We
already
will-
spent that money.
28,000 we have.
Yeah, that's what they gotta pay back.
That's what we had.
Is that what this 20,000, Mr. Chair?
No.
This 20,000 isn't part of paying that 28,000.
No, that's
That's
going
additional.
forward with the engineering that's coming beyond that.
I guess I don't even know how to say this really. I'm trying to think long-term here. To get this project complete, I almost see it impossible. And I might be totally wrong here, but I'm thinking you're gonna go through 2 lakes and down, and I just can't believe that the permitting and all this stuff is going to be possible at some point in time. And maybe it is. I know you're working hard at it, but that's where I have to question on how much money is spent up front to make something happen. You know, even those landowners, a lot of them will, they understand your hardship with your lake and this and that. But when I have to start signing a paper saying it's okay for you to run all your water by my house and into my lake, I have a feeling that it's gonna change. You know, but I don't know that. I'm just thinking out loud here. I'm trying to think, how much money do we spend to proceed with that? But that's, I don't even know if I have the authority to do that.
Well, the only way we can do it at all is to have the feasibility study, environmental engineers do the study to
The
validate.
feasibility study's done already.
Yeah, the feasibility
Right.
study is done. And the feasibility study says, it looks like this is the best way to do it, because we're looking at the natural hydrology, the natural flow of the watershed. And since we have a basin lake, and we have water that's coming from our watershed into our lake, beyond the single tributary that is going into our lake, we got water coming into our lake, and because of construction changes over the last 10 years or more, we've had more water coming in and no water going out, and it's going to continue to go up. It has been continuing to go up, and there's been lots of destruction.
And if I may share, I understand where you're coming from on that feasibility study, but the question is on this engineering study. If you could explain to me for sure, is that $20,000, if you would get the $20,000, but you don't get the grant that you're applying for, it might take a year, 2, 5 years, who knows? What are you gonna do with that engineering money? Okay, you're applying for, you're asking for $20,000 for engineering money, correct?
Engineering and.
Well,
and
administration,
Also
legal
going
op-
through this 429 process.
Right, okay.
Which is a lot of meetings like this with commissioners and with township boards and with DNR.
So that money you're gonna spend regardless. You have to get this, to put this above the feasibility study, correct?
Yes, yeah,
Okay, so then what happens if you don't, now, you're applying for a grant too?
yes.
Okay, what happens if the grant doesn't go through?
If that doesn't go through, then the cost will be, like we said, on the bottom line. If the grant goes through, then it'll be half of that.
So I understand that, but if it doesn't go through, each person's gonna be assessed between $300 and $3,500?
No. Well, if the grant doesn't go through?
Right,
If the grant doesn't go through, yes, they'll be charged that, right. Between
the
$300 and
project goes through.
$3,500. Yeah,
because again, if you know, if everything does, but you don't get the grant, but you wanna continue with the process, you would assess everybody 3 to 35. I understand you have to have all the meetings and all that, but that's where that would come into play.
yeah, the only time that $300 to $3,500 would be the cost to us property owners would be as if the grant, the construction was approved, everything was approved,
Right, I
and we were
understand
gonna complete the project. That would be the cost of the project.
Would it be an annual cost to pay off?
Well, that's another part of it, where we'd be applying for bonding.
So is the 3 to 3,500 an estimate that would be to pay for the bonding of the 1,500,
If-
1,500,000?
Yeah, if there was no bonding, and no grant, that's what the cost would.
No
would
bonding, no
likely be.
grant, pay it in a one-time, 1 year, what,
Yeah.
you know what I mean? I'm
Yeah,
trying to
yeah,
get, is
yeah,
that paying for debt,
yeah,
or is that
right,
paying for
right.
total cost of project?
Yeah, it would be a total cost
How
to
many-
a person if there's no bonding and no.
How many
That's
land-
estimated,
Yeah.
that's an outside
landowners are
estimate,
there?
but
How many parcels are there that get assessed?
about 375, something like that.
That seems like a cheap
Yeah.
amount of money to me.
There's no interest in that.
Well, no, but to me, that seems like 1.5 million seems like not very much money.
If I take 1.5 million divided by 375, it's 4,000, so.
Okay, she did that.
Yeah, and we have the commercial people that are assessed more too. But the
Yes,
whole
there's
thing
more
is,
formula that goes
but the
into
whole
it.
thing is, this is just an estimate, and that's not clean. When you go in that 429 process, which I've never been in it before, you guys probably have, because municipalities go into that if they do, curb and gutter kinds of things. Maybe that's the city, not the county, I don't know. But anyway, we have to go through that process, and that's a very legal process, goes down the line. And so we have to reassess. We might not have the same assessment we have now, or the same formula to assess ourselves now. There are different formulas based on benefit. That's what this is. If you go into that 409 process, I might be benefiting more because I'm a low, I have a property on the lake level. The people in the association that are up above, they'd be paying less because they are away from the water. And it's based on, from what I understand, it's based on market value. If your market value increases about the same amount you're charged, or stays the same, then it's considered fair. And the whole idea is to assess ourselves fairly.
Deb, that would be no different than the watershed that we just talked about.
Well,
With assessing people that, am I correct on
well,
that, kinda?
maybe, I don't know how that works, I don't know what the 420, that's what I'm trying to figure
Yeah, I
out,
know,
because we
but-
have a formula that's set within the rules of the Lake Improvement District on how you can assess property. Remember, we've talked about that quite a bit, and that's how that commercial property changed.
Yeah.
How does a process change in terms of, it's not a per parcel assessment, like, would we have to change the rules that govern that Lake Improvement District?
No, it's just for this particular situation. It wouldn't be changing the way we assess our annual thing, but just for this project, this
But
special project.
Do you as a lid have authority to do that, or is that why you have to come to the board to be able to bond for that, because you don't have?
For
the authority?
bonding, we have to come to the board, but, yeah, I think it's our responsibility to legally prove that the assessment of our property owners are fair, based on benefit.
I gotta be honest, I don't know exactly how that all works. So
Well-
there's a, you know, and we haven't worked through that. Deb's not here to
Yeah.
explain it, and I don't know
Yeah.
if she's aware of it or
Yeah,
or
I've
not,
talked with Deb a lot, and she's somewhat familiar with it too, but I don't think she's dealt with it a lot either. That's why we've had to retain an attorney that does this sort of thing. And the law is very clear about how fairness is the big thing. And so it takes into your concern, I think, in terms of how we assess ourselves.
And the 1.5 million at this point in time is just an estimate also on
Yes,
costs,
yeah.
so.
It's a-
Really, that part of this equation for today doesn't even matter, does
Nope,
it?
doesn't even
Except-
exist. I was confused
except-
when it says proposed 2018,
Yep,
because we can't
yep.
do anything else in 2018
Yeah.
other than what
Well-
you approve as an ultimate budget
Yeah.
and
The
the
only
specific
thing that
assessment.
Maybe I should just take that middle part out.
Well-
I don't
Well,
know.
but
Well, I
I think
think
it's
we
for
should-
informational purposes. I just wanted
Yeah.
to make sure we were all on the same
Yeah.
page that come next July, if you
Yeah.
determine and you know you get that grant or whatever it might be, or who, it's not like you can change and get different funding for 2018. That, we're just on the
Right.
same page
Yeah.
there, so
Commission-
it's only the 1 year assessment that you
Commissioner
set.
Jelinski has.
Mr. Chair, Bob, can we go back to that $20,000 on the top part?
Yeah,
If there's I just need to know the answer to the question. If there's a grant that becomes available in 2018, will that go towards that $20,000? Or is that $20,000 gonna be spent no
it'll
matter
go
what?
through all as I understand it, talking to Pat Lynch, who monitors the program, state DNR, he says that if that's approved, the grant can pay for 50%, it's a match. We'd
Yep.
have 50% of everything we haven't paid for yet.
So at the end of 20,
And that's why our engineers and our attorneys aren't gonna be billing us until that happens.
so at the end of 2018, is it conceivable that we would only spend $10,000 out of that $20,000 that is budgeted for? Because 10,000 would be a grant, if the grant would come
Oh,
through.
yeah, it's possible, yeah, it's possible.
That's
It's
what I
possible.
need, okay.
If I may, Mr. Chair, there's two important questions. Commissioner, you had one, Commissioner Lemire. Again, there's people that weren't sent letters, that were not able to attend the meeting. Okay, that has a challenge to me. And the other ones too is, the question hasn't been answered that Commissioner Lemire asked, is where would you get the money if we wouldn't approve the 20,000? Or
Well-
would just just stop to everything and life goes on?
I
Two
guess-
questions I have there.
I guess we would, we wouldn't have to pay that until July, okay?
July of next year,
July of next year,
of 2018.
right? And we would then probably not pay back the association, that 12.5, so that would help us. And, I don't know, to me, I think this is, important for us to do, to have that. We want to have a budget that is responsible. We're a lake improvement district, and we are working for you. I mean, we are trying to save property value on the lake. We're trying to save the lake, water quality of the lake. And I think, I would really be disappointed if that was the case. But I think we'd have to do it somehow.
Mr. Chair, can I ask a question? When the meeting that I was at, there was a number of property owners that were there that were opposed to this, and primarily Crookneck Lake Association was
Yeah.
opposed to that. Have you worked more with Crookneck and
Yes.
your neighbors,
Yeah.
and how is that going?
Crookneck is our neighbor, right, and we get water from them, underground water. And they are flooding too, they have got lots of damaged properties, but a number of them like the high water. For reasons, our shallow lake and the high water, but there's lots of trees going down there too. But we've worked with them, and we are working with the DNR too, to see how our relationship should be working. And, I mean, our hydrologist, Ken Zeke, isn't with us anymore, but there's someone filling in for him until they can replace him. About, you know, we're basically a foot different, they're about a foot higher than our level. And so if we take out a foot, theirs will go down a foot. And so we're looking at a reasonable compromise to see how much we take our lake down and how that affects our lake and their lake. And that we wouldn't take it down any lower than their feelings.
Do you think that you'll ultimately get Crook Neck support as an association? I didn't hear it that day, and I'm just wondering if that's.
I think for a
what-
modified level, yes, for some modification there.
So that's yet to be determined though, so how, you know, the expense of this and what actual improvement or modification or level you'll be able to get agreement at could be different, or
Yeah.
those
It
expectations
could
certainly would
change
need to
it.
be set.
For example, we might want to drop it 2.5 feet. And they might say, well, that's too much for us. And we'll say, well, how about 2 feet? And they'll say, we might say, well, come down to compromise in there.
I have a question. Were we aware at any time in our discussion that this was gonna double this year? I mean, there was no planning session or nothing like that we had talked about, that the lid would double in price? Or was that strictly at the annual meeting where that came up? I guess what I'm trying to think is, if I'm gonna double somebody's assessment, I'd like to make sure that people were aware, that people were in favor. And Commissioner Lemire, you were at that meeting, and I guess
Was it
we're.
the 429, I left that for that. And I assumed the budget was after the 429 meeting?
The budget, yeah, the budget, but, I mean, we can't predict how, the year after, 2019,
No,
how
no.
it's gonna go up.
I think what I'm referring to is if you're coming here to propose doubling the fee.
Yeah,
And you told me that at our annual meeting, we're gonna talk about this, doubling our fee. I think I would have tried very hard to be at that annual meeting to see
Yeah.
what people are saying and doing, because
well,
I'm gonna double
yeah.
their fee.
Yeah.
And please, no disrespect, you're coming here telling me that the majority of the people there were okay with that, but there's also people that weren't notified in this. So I'm just trying to put my hand around this.
yeah,
I-
the people that weren't notified were there at the meeting. They were at the meeting. Because that's how I found
Yeah,
out.
well, and you
That's
did-
how I found out they didn't know.
Well,
about
and you
it,
did
hadn't heard about it.
notify them in the legal paper,
Yeah.
that part of it,
Yeah.
so.
And the process is to come to you as a board to approve that budget on an annual basis, and it's the job of the Lake Improvement District to make that budget and to get their association recommendation from that, and that's what
Yeah.
we look to
Yeah.
them to do. It kind of gets mixed up, it's a little confusing because of this project that's occurring with it. As part of what that Lake Improvement District is. I think there's, probably a lot of work that needs to be done to really garner support as a whole for entities and individuals out there. And so I guess that's kind of where maybe some of the questions come
And,
from.
and I understand that, because again, we know that there's gonna be a lot of people that have to prove permits, DNR, I understand all that. Question I have, Mr. Chair, to Bob is, at this meeting, how many people were there roughly? How many voted yay, how many voted nay? I'm just trying to figure
For
out,
which one?
for this 20,000, for this year's budget for.
This year's budget?
Yeah.
It was, I have the minutes here, and I don't know, I think I gave you our website, all our minutes and everything are posted on that. This is what our treasurer
If I may,
gave.
Mr. Chair, we got somebody in the back there that's giving.
Yeah,
Well, there were two meetings that day. One was for your association, and then the next one was just the lid. Correct?
What day are we talking about?
On that Saturday at the church?
About August 26th, I
On the
believe.
27th,
Yeah.
26th? Yeah, right, the association had a meeting in the morning, right?
Yeah, so that, you
early.
might want to clarify
Yeah.
which group really actually voted for that.
Oh, it's the lid, the second meeting.
Okay, and that was
Lake
the one where,
Improvement
yeah.
District.
Okay.
That's where we had close to 300 people.
Okay, yeah, but, yeah, okay, and then all the people from Lena Lake and Crookneck weren't included in that
No,
vote.
no,
They
they're
weren't-
not included in
They
that.
don't know
No.
about this.
Let me ask this question here. If we would table this for a month so that we don't take the 20,000 out and we don't, what information would we want?
429, I would want information on that.
On what?
429?
429, yeah.
Did you have a meeting on that alone for your lid, on the 429?
Yeah, well, at that meeting, the engineers described the whole process. Were you at that little meeting?
I was.
You weren't?
yes.
You
I
were.
was.
You were there.
Yeah. There was only
And-
like 3 people in our whole neighborhood that was there.
Mhm. Yeah, your neighborhood is like 13?
Yeah. If you, yep, I guess it depends on
13
who you
properties.
count. You said that people who are paying for 3 portions of it only got 1 vote, and there was no proxy votes allowed, correct?
Yeah, there were proxy votes. There were proxy votes.
Okay,
That way, okay. But
let's,
anyway, okay, sorry.
let me see here once. I'm thinking that we should table this for a month so that we don't approve something that we're not quite sure about.
Do we have a month, or we have 2 weeks?
Or
next
2 weeks,
board
I
meeting?
mean,
It,
whatever.
sometime by the end of November, for
So it
sure,
is?
it needs to be done, but my recommendation would be that, maybe Bobby bring in some more information to one of the planning sessions this month, either next week if you can, or the following planning session to get in front of the board. I don't know, exactly how that bonding would work and how that assessment would work. I'm curious
Yeah.
about that. I guess I need more
I'm
information.
surprised, I guess I assumed that Deb Lau was gonna be here. She's as much familiar with that as I am, probably more. And I'm not familiar with it at all, but.
And I guess how that's assessed and how that would be spread out, because ultimately that's, I mean, to start a project and to ultimately pay for, you know, $1.5 million project, it's kind of a big deal. I think that maybe needs to be laid out a little bit better at the outset, because that's gonna really individually impact those property owners. So I think that's something that I don't know, I would probably be good to
I guess,
understand a little
I
bit
guess
more.
I need to know what you want me to do.
Yep.
Well, first, Mr. Chair, if I may, I think you gave us a lot of information here, Bob. I truly do. And it's broke up into thirds. The top third of 56,400 is really what you came here for,
Yeah, right.
I think.
That's,
Yeah.
that's
Yeah.
right.
I think.
Yeah.
And how you came to that 56,400 is explained. And quite honestly, and I know that I'm not gonna be a popular vote when I make this statement is, people were notified
Yeah.
to come to the meeting. Now, whether or not they got notification in a letter from the US mail, whether it was in the legal paper, whether it was on the internet or anywhere else,
Yeah.
there was notification that was made. As with any election, not everybody goes to vote,
Right.
quite honestly. And I just want to make sure that I'm on the right page. We're here today for 56,400 for the lid.
Right.
I guess to add on to that, we're here for 56,000, but 20,000 of that is for a project that, yeah,
Absolutely.
that's,
Yeah, I got it.
Yeah, that we're working on.
would,
And I guess one of the, Mr. Chair, one of the problems or concerns that I have is, it seems a lot of times that we're putting the cart before the horse. It'd be nice to see, because I went to the crook neck lid, and I'd say 90 to 95% of people are concerned about the dropping of Shamrock. So it'd be nice to see support from those individuals from Crook Neck, and of course, Lena's gonna be affected probably the most of any as you're dumping directly into their lake. And, you know, what does Todd County think about this too? I'd like to hear about that.
But you've already spent the $20,000, right, for,
No, 28,000.
well, I know, but you need the 20,000 to pay the bills of money you've already spent?
No,
No.
Okay,
The
No.
12.5 is to repay the loan that they
took out,
took out to pay $28,000 for an engineering cost from, that's who they borrowed money from the Lake Association.
right?
And the 20 is for work that's going to be done, or kind of is currently
It's
being
current.
done.
But you also said that they weren't gonna bill you to July
Yeah,
of
the 28,
19,
that's-
No,
18.
or 18, July of 18. So,
The 12.5 on there, is that being used to pay that 28 then?
Yes,
Loan repayment?
yeah,
See that 12.5?
That-
right,
yeah.
Does that pay it in full?
So then- but
or
then
do
you
we still
said-
owe more?
The 28, yeah, that's paid. Although they haven't billed us for that either.
But that 12.5 here would pay that off.
Part of that would, that's what, yeah, that's what we use.
That would pay the 28,000 that you borrowed. That would pay it off.
Yes, that's part of paying that, along with our final, what do you call it? In November, we get our second half.
Out of the $28,000,
sec-
you only owe 12.5 left on that?
Pardon me?
On the 28.5, you only owe 12.5 left?
No.
Okay.
We have the second half of our income coming in at this, probably not till December will we get that check. That, a significant part of that is part of that
So like
28,000.
Commissioner Zelinski asked.
Which was
if we pay the
budgeted.
12.5, then will that 28,000 be paid off? Or are you still gonna owe more money on it?
No, that'll be paid off then, yeah.
and I must be not hearing things correctly. You said that if we didn't give you the 20,000, then you may not be able to pay back the association.
Right.
But I thought that this 12.5 here was to pay back the association.
That's what they use that money for,
They'd use that
That's what
12.5
we
then
use that
for their
money for.
engineering,
yeah.
instead of paying their association back.
Oh, okay.
Oh, I get what you mean.
Yeah.
Well,
I
what do
think we need a little bit more information on the timeline of the work that's being done. And I know you talked to
Well,
the,
I can tell you this,
well, I think maybe in a next
Yeah.
meeting. So I think the board's kind of given direction that we're not gonna vote today. So, we have a couple of meetings coming up, let me get the
Not
dates
voting,
here.
Bob, strictly because we want to get it right.
Yep, and I think we need some more
You know what I
information.
mean?
So,
That's,
Yeah.
we want to get it done within your timeline,
we have,
but I think we have enough questions that we want to ask some questions. to
you know,
get it
I need
right.
to know what those questions are, so I can do what
Absolutely.
you need.
Absolutely.
the next two planning sessions are on the 17th and the 31st. And I think we need to shoot, or ought to shoot for maybe a 7th of November vote date on that. I know it might not be possible to get everybody together and get the information together, but I think perhaps a discussion about maybe from your engineering firm, what's going on, what work's being done, the timeline of how that's going to work.
How about if we talk about, how about if you email him with some questions that we may
Yes, I will
have
do that.
on that so that you can answer some
Mr. Chair,
questions?
again, Commissioner Lemire brought up, would we want somebody here from Cook Lake, what was the other lake?
Lena.
Lena and Todd County to give their proposal?
Well,
or-
and Mr. Chair, we've had meetings. I was
You don't need to
at
have a
one,
hearing.
on August 11th that had, some of those stakeholders at the table, and they've had meetings before with those. We haven't had the ability to have full representation at those, but it's a little bit more of specifically what Morrison County's involvement will be, or what's being asked of you to approve. And I think understanding what that timeline is, understanding what the ultimate financing will look like, and how that would work. I mean, you had talked briefly back this summer sometime, you came in and talked to the board about kind of just a high level about what is going on, but I think we maybe need to dive a little deeper on what the expectation or the thought is on the
Get it.
expectation of what's happening with that. Understanding the financing and how that would work, because it's gonna be a question ultimately to you five about bonding for any type of project that goes on. I think it's very important that, you know, neighbors are being good neighbors and there's support with that. Because I agree, the people that I heard from at that one meeting from Crookneck were not supportive of this. So how is that going to look, or what is the anticipated process
Well,
to
would
be
that
able
make
to
a difference?
educate?
If they're not supportive, this project is null and void, I'm assuming.
Well, I'm trying to think of how much money do we spend up front?
Right.
If, to think that, you know, if I knew that people were very supportive, and at the end of the day, if there was no grant, and they're willing to spend $3,000 to $4,000 per parcel to fix a problem, I would be more supportive about spending this money up front. You know, but to spend the money up front, not knowing if there's support at the tail end of this, because the real story is, will you pay $3,000 to $5,000 per parcel to fix this problem, if we can even get all the permitting and all this stuff? Because if the answer is no, then how much money do we spend up front to do that? And maybe I'm speaking out of line, I don't know, but that's what, I'm just, if I knew that people were in support of fixing this problem, regardless of what it costs them here, into that time range, I have no problem supporting what they want.
In our vote, we had a vote for that project at the annual meeting, and it was 2-1 in favor of going forward.
Those
That's
were-
why we went forward.
Those were just property owners of Lake Shamana that happened to be
They're-
present,
they're
right?
all invited,
So
yeah.
they weren't Crookneck representation, they weren't
Right.
township, they weren't Todd County, they
Yeah.
weren't Lena representation, that was just Shamana property owners that were present, right?
Right.
So I think there's more support than just the property owners that needs to be understood, maybe, at least that's kind of what I'm hearing the board say, that how do we do that? And maybe that's what we could talk about at the planning session too, about how do we gauge that a little bit more directly or accurately to
I
understand.
tell you, we have a lot of things on the
Yeah.
agenda. Why don't, we'll have Deb send you an email with some questions and some things that we'd like to answer. Because I don't think that we're not in support of things. We want to support things that we feel is going to go forward. And because there's a lot of money that's got to be spent by individual homeowners to make this whole thing happen. And, go ahead.
Mr. Chair, I just need to comment one more time. In respect to Bob, he did hold a vote.
Yeah.
And the vote of the Lake Improvement District was to, I wasn't there.
Yeah.
Was for you to come forth with a budget of 56,400.
Right.
If tomorrow you do the same thing,
Yeah.
and only so many people show up, no matter what happens,
Right.
the vote could be something different. I understand that, but it's only based upon those that are there. But, and that's just for the sake of argument in
If I
all
may,
respect.
Commissioner Jinsky, I respect too, but again, maybe there was information there, because you know as well as we do, that we'll get information today, and then we
Absolutely.
get something tomorrow. So now
Absolutely.
they maybe didn't get the right information, or they didn't get enough
Don't know.
information. We don't know that, and that's what we're here as the
They
board
got
is
a lot more
asking.
information than you did.
Yeah.
They had the engineer there.
Well, out of respect for all the work
Yeah.
you've done, I just need more time with this,
Sure.
because
Yeah.
this is the first,
Yeah.
I feel whenever I'm gonna double somebody's fee, that I need time to think about.
Yeah.
It's not, I thought that this would be more in a planning session, that we would discuss the fee going up, why, so forth, but that's just me, I just wrong, I guess, on this. You know, but when I'm gonna double somebody's fee, I wanna take a little bit of time
Yeah.
to think about what we're doing. I'm not saying you're wrong, I'm not saying
Yeah.
any of that, because Jeff's right. When you put out the annual meeting, this and that, I just feel there's a little more involved in with that $20,000 down the road. But let's do that. Let's table this for now, so that way we won't vote on it, we won't keep that out. And you come back and we'll,
When you want me to, which meeting?
Whichever works for whomever you think ought to be here, if you think the engineers need to be here or something like that, I don't know. So there's the 7th and there's the 31st.
7th? or
No,
31st?
not the
No.
7th. November 7th is the meeting that we want you at. What's the
Yeah.
next?
To vote on.
17th and the 31st.
Next Tuesday.
Deb, would you be in contact with Bob and
Yep.
talk about this
I
after the meeting? We'll talk about it, Bob, there, okay?
I'll shoot
Thank you
an
very
email
much.
to
Okay.
Bob.
All right, thank you.
Thank you very much.
Thank you, Bob.
Thanks,
Thank you.
Bob.
Thanks for all the hard work and the information you brought forth.
Here are extra copies. Thank you, sir.
Thank you.
Okay, next we'll move on to South Country Health Alliance, Leota. Thanks, Bob.
Morning, Leota.
Good morning.
Tall chair, my feet barely touch the ground.
The way you've been running, they never touch the ground.
Well, it's nice to be back in Morrison County. Happy to appear and give you some updates on what's going on with South Country. I've got a couple areas that I just wanted to kind of touch on today. So the first area that I wanted to just share some information with you on is the work that South Country has been doing on our health information exchange. And so, you know that the model that South Country has had has really been about coordinating care and services across the full continuum of care. It's not just the physician and hospital visits, but also public health, human services, behavioral health, pharmacy. It's really looking at that full scope. And so over the years, we've done that work. We've done it by investing a lot of manpower and manual kind of processes of a lot of faxing and telephone calls and creating spreadsheets that we're sending through to share information with providers and county staff. And we really looked at the development of a health information exchange as a way to have that process be much more efficient, but also to really improve the coordination of care between our members because the information is more readily available, it's more real time. So we invested in the technology of developing this health information exchange. Over the last 2 years, we've been working on this. It's been a long process. We stood our first county up in the end of May. Kanabec County was our first county to go live on the system. And really the piece that's happening now is the transfer of admits, discharges, and transfers. So what happens is when a person presents to the emergency room, as soon as that emergency department visit is entered into the system, it automatically triggers a notification to those that have the consent to be able to receive it. So it really is about much more efficiently, much more timely being able to share that information that an event has happened with a person that we're working with. So still in the early stages, kind of working through that, but one of the areas where we look at some real opportunities is, for instance, home care. Our counties are rural. Oftentimes we have home care nurses that are traveling an hour to go out and provide service to the member and get out there only to find out that the person had been admitted to the hospital the day before. With the ability to share this information, they would have that on the front end. It really is helpful too, and I think will provide a much higher level of care for individuals when they're being discharged from the hospital, because we'll know that that discharge is happening. It provides the opportunity then to very promptly go out and do a follow-up with that individual, make sure that they have the medications that they need, that their follow-up appointments are scheduled, and those types of things. So we're very excited about some of the efficiencies, but the improved quality of service that this can bring. So as I've just kind of talked about, some of the benefits we really see of this is the improved care coordination and the improved communication between providers, which ultimately leads to better outcomes. We think it can reduce or eliminate some of those duplicative services. Sometimes you're not aware that another individual is also working with that member, and kind of two people, care coordination especially. Sometimes you have a care coordinator at the clinic, a care coordinator at the county, maybe with the health plan, and you've got lots of people doing the same type of work. It really is about having the right information at the right time for individuals. That improved efficiency and reliability, but quality and safety. Medication errors are one of the biggest things, and kind of the next step with this process is really building a community care record in which, in a centralized location, those individuals, those providers that are working with the member would have access to all of the same information. So as part of this process, we went through the certification, and I'm happy to announce that in August, we received our certification from the Minnesota Department of Health as a health information organization. So this is kind of one step up, but the reason we felt it was important to pursue the certification is that the way policy is written within Minnesota is that if you are an HIO, a health information organization, you're required to connect to other HIOs. So because we're a regional plan, we don't cover the whole state, we know that there's other providers that are going to be connected with other types of health information exchanges or even their EMRs. So by connecting with another HIO that they're connected with, we still have the ability to access information. So it gives us a broader perspective. We've also had some conversations with Wisconsin and South Dakota. They have state information exchanges that really are using the same platform that we're using. And so there might be the opportunity to link there. And we do have, especially over in the eastern part of the state, folks that are accessing services across the state line. So improved efficiencies. As we roll this process out, we're meeting with our communities. We're really working with them to identify who are the people that need to be at the table, and taking it forward as a real community effort. The other piece of this, though, is through the exchange, it gives us access to a lot of analytic data. And I'm going to share just some of the basic, and some of this is just some updates that I like to kind of provide to you with enrollment and kind of what we're seeing with claims. But the other piece of it is really a lot deeper view into the utilization information. And Dr. Brad Johnson, our Chief Medical Officer, has really kind of dug into this and has gotten really excited about the information that we're able to access. And he's been going out and meeting with our primary care clinics. So I know he's met with St. Gabriel's Unity to share information that we're seeing regarding how the utilization of our members, the services that they're using here, and how it compares with other primary care clinics within our region. And it's providing us that opportunity to kind of really look at, are there opportunities to work together to really look at how we improve the coordination of care for our members, or are there opportunities to look at how we can reduce some of the healthcare costs? So this work will be continuing on. But to just give you some updates, current enrollment as of September in Morrison County is over 6,000 enrollees now. You are our county with the largest enrollment in South Country Health Alliance. And actually 19.5% of Morrison County's population are receiving services through South Country Health Alliance.
If I may, Mr. Chair, is that good or bad?
Well, I think it's an indication, and especially in the northern counties, these are counties that are rural counties, typically lower income counties, also aging counties. And so when you have that kind of a mix, you do see higher enrollment in the Minnesota healthcare programs.
And Mr. Chair, it depends on how the mix of that population is health-wise, in terms of whether that's, something that helps the bottom line in a positive or a negative.
So as we look at the products, and we've talked about the products a little bit before, and I'll leave this with you. This is a document that was put together by our team and used with your counties as they've come out and met with counties for the annual enrollment period. That just gives that little snapshot of here's the products that we do, enrollment, some of those kinds of things. So basically just informational. But as we look at the products, you see that the vast majority of the enrollment is in that PMAP product, which is the Medicaid for individuals under age 65, and Minnesota Care, which is the subsidized program. It's really kind of that working population that doesn't, their income is too high to qualify for medical assistance, but they don't have access to health care through their employer. Pretty similar to South Country, your PMAP and Minnesota Care enrollment is a little bit higher here in Morrison County than what we see across South Country as a whole. Your senior population is lower, and that is really the result of when we started doing the senior products in Morrison County, you already had 3 other plans here offering those products. And so we just haven't made as much of a influx into the population. It's always interesting to kind of look at the age groups, and where we see just a little bit of a variation, slightly higher percentage of individuals between the ages of 40 and 64 in Morrison County. And so again, those are individuals who are most likely enrolled in that PMAP or Minnesota Care product. Again, the seniors is less enrollment here. As we look at expense, obviously, because of the higher enrollment, and it's good that we see this because it matches, the vast majority of the healthcare expenses are for that PMAP and Minnesota Care population. You will see the single care is a little bit, and that the single care is that Medicaid program for adults with disabilities. Last year, there was a total of just slightly over 175,000 claims for members from Morrison County. As of August, when this was reported, we had already seen 104,000 claims, so we're seeing those claims counts go up. It's pretty consistent with what we've seen, higher utilization of services across all of South Country.
I have a question on this. How does this pertain to when, let me see, how do I want to say this? Wasn't there a time like a year or two ago when a lot of insurance were, let me see, did we cut back? Remember the state took away some of our, and added things for counties, and some people went to other, am I correct on that?
Yes.
Okay, so
and-
how does that relate to these numbers? Is, when you're comparing 16 to 17, does that affect any of that?
It does somewhat. In 16 is when we saw 2 plans in all of our counties for PMAP and Minnesota Care.
Okay.
As of May of 17, when Medica left the market for PMAP and Minnesota Care, if you look back on that enrollment slide, you can see that there was a pretty significant change in enrollment from May to June. And so many of those members back in. So where we're at with our membership now is more consistent with where we were at with membership as of December 15th, or December of 2015. But what we're seeing across the board is membership is growing, not just because of reverting back to that single plan status, but more people being eligible for
What are these
Minnesota
numbers
healthcare
kind of
programs.
comparing apples to apples, or is it because of that other offer they had with other insurance companies at that time changing some of this?
It changes the membership between 16 and 17, so
But that
higher.
would change claims too, would it not?
Yes.
Yep, okay, it don't matter.
Mr. Chair,
Yes,
if I may, in 2016, you had 175,000 claims in Morrison County. So that translates into, as an example, so-and-so going to the clinic and having a sore throat, whatever it might be. That's $5 million. At $30 a crack is what I just am saying. Am I on the right page?
Oh, it's more than $5
It's
million.
a lot more. No, it's a lot more. But at $30 a visit, I'm just making that up as a figure. $100 a visit, pick whatever you want to. That's $5 million at $30 a person. There's an awful lot of money is what I'm trying to
Yes,
say.
and actually, I
that
have some
goes
claims
through.
costs for you a little bit further on
There we
here.
are. I'm way ahead of you, okay.
So as we look at the, on which slide am I? You're on age band.
I'm sorry, do I want to be on each one?
Yes, that's fine. I flipped ahead. So with that, as I said, there was a slightly higher enrollment in that 40 to 64-year-old. It was only a 1% higher membership, but actually the claims costs are 12% higher for that population. So that really is where we're seeing some of the expense. And that's where some of these analytics are coming in to be very helpful, as we can now kind of zero in and say, okay, this is an area that we need to focus on. What's driving the claims costs here? What can we look at? Are there things that we can do to help impact that? The next slide, when we look at just kind of a breakout, and where are those claims, what kinds of services are being expended? And this is actually a slide that we really like to see, because in Morrison County, you will see that the outpatient claims are higher. And typically when we see outpatient and professional claims being higher, we see less utilization of inpatient hospital services. And generally speaking, that's a positive thing. Generally speaking, it means that people are getting the access to the care that they need on an outpatient basis. They're receiving the preventative services, and by doing so, you're able to avoid some of those more costly conditions that require inpatient hospitalizations. So generally speaking, it is a positive when we see that. So here's your numbers Commissioner. When we look at Morrison County, the total claims expense in 2016 for South Country enrollees in Morrison County was over 29 million.
Wow.
And again, you see the breakout that a large percentage of those claims are being generated in that outpatient and professional kinds of services. And pretty consistent, so it's 14.6% of the claims, and it's 14.5% of the membership. And we tend to see, it align pretty well.
And kind of just as a perspective, and what always amazes me about this business is that's, 19.5% of the population in Morrison County, and the cost of healthcare
Exactly.
for 19.5% of Morrison County is $29 million. So just the scope of healthcare and costs and what that means is sometimes a bit overwhelming, because
Absolutely.
it's a lot.
So on slide 13, we've started to take a look a little bit about what are the costs that are actually being incurred within our counties. And we're looking at this information for a number of different reasons. It helps us to potentially identify where there may be gaps in services, certain types of providers that aren't available, what are the kind of natural referral patterns that if certain services aren't available here, where are they typically going to receive care? And so we found it kind of interesting. Now, this one is excluding pharmacy costs, so it's just the medical claims. But 43% of those claims, of that overall 25 million without the pharmacy, 10.9 million of that is actually occurring here in Morrison County, whether it's through your clinic, your hospital, mental health services, all of those types of things. So you've got 14 million of it that's going outside of the county, where people are accessing their care outside of the county. A little of this can be triggered a little bit by if it's a group that has multiple locations and their central billing office is outside of the county, that may factor it, but it's going to be slight when you look at the overall scheme of things. So when we look at those dollars that are going outside of the county, where are they flowing? And by and large, the two largest groups are St. Cloud and Minneapolis. On the next slide, again, it kind of helps you see, so St. Cloud, Minneapolis, Brainerd, Staples, so it's that surrounding area, and we do like to see that it's not, someplace that's 3 hours away where all those health cares are going. So an hour, hour and a half, people are being able to access. But on the left side there, it's really kind of calling out, and I don't think that psychiatry is probably a big surprise in our rural areas. Psychiatry, mental health services are a struggle, and so people are often accessing those services. But it really is those specialty services, so cardiology, orthopedics, rheumatology, and that's where, you can really look at and identify that you maybe don't have those types of providers here in the county. They're being seen by their primary care, and then they're being referred out and accessing their specialty care at bigger healthcare systems, larger healthcare systems. So this is an area we're going to keep kind of digging into, and again, I think it's one of those areas that we look at, and as we work with our clinics and that too, and can share information with them, it helps them identify if there's a certain specialty service that's not available. What, is it feasible for them to begin to build services if there's enough demand? We ask our members to select a primary care clinic, and by and large, Morrison County enrollees are using Family Medical, St. Gabriel's. And then as we just look at top 10, and the piece that I want to call out with this is that when you look at the dollar amounts here, this is not the dollars, so for Family Medical Center, that's not the dollars that are necessarily being paid to Family Medical Center. That is the total expense of health care for those 3,291 members that have selected Family Medical Center as their primary care clinic. So it brings in those dollars of care that they may be receiving outside of the system. But this is helpful for us to look at because as we look at and explore trying to pursue more value-based types of agreements with providers versus just a volume fee for service, it really helps the primary care clinic have an understanding of this is the total dollars of those individuals that you're serving. And so how do we work together where you can influence and help manage the care that can impact the cost for those members. So I'll pause there. Any questions on that section?
You know, when you say help on cost, I have a question. I don't even know where this goes to, but medication. You know, I've run into 2 times now where people have gotten medication and it's like $3,000 and they take 2 or 3 pills and they find out they're allergic to them and they have to throw them in the garbage the rest. Isn't there a program where you could give them a week's supply or something to make sure that they're not allergic to them? I mean, I can't imagine how much money we're throwing away in that end of the world just because people can't take them after they've been exposed to them.
That would make great sense, but unfortunately, no.
Nothing to do with your stuff.
Not at this point. You know, basically, individuals are able to get a 30-day script. That's the rules under the Medicaid, and in some situations, it's a 90-day.
This doesn't make sense to me.
No.
Especially
The
in
more
the-
information though that we can tackle, and that's the beauty of South Country Health Alliance, is we are owners of this information because it's us as counties that manage this. And so we're able to find areas and dig into them and say what makes sense. When you speak about prescriptions, I mean, the work that South Country funded to help with that opioid task force and really identifying, okay, this is the cost of what's happening and what members are accessing, we were able to really get a starting point on trying to figure out how big of an issue it is. And the reduction in cost as a result of that is tremendous when it comes to pharmacy from the insurance component. So there continues to be ideas and thoughts, and that's the whole point of getting that data. And then it's working with providers and those docs on how they do business to try to contain costs too. So there's a lot of opportunity
It's just
there.
the pills cost so much for some
Yeah.
of these pills. You'd think there'd be some limit to where, how much do you need before you find out if you can take them or not?
And I think, I think with the allergic reactions and some of that is more the exception than the rule. Definitely with some of the more high-cost drugs and the specialty drugs, one of the things that we try to do with those is that when we know that there is an individual utilizing that type of a medication, is to try and do some of that care coordination to really ensure that the person understands what it is that they're taking, why they're taking it, to ensure that they're taking it as prescribed and as directed. But it is a challenge.
Thank you.
It's a great point, a great point.
It's just if we don't do some of these things in our medical field, the prices are just gonna continue. I mean, nobody's got a handle on this thing,
Exactly.
you know, so, okay. You can move on.
Okay. So when I was here this spring, we spent a significant amount of time just kind of going over all of the financials for 16, where we were at with 17. Wanted to at least provide you an update with that. I am happy to say that we are definitely on target and actually performing positively to budget. As of August, our net income is 1.7 million. We actually had budgeted for a 1.2 million loss for August. So we are 3 million favorable to budget. Now again, this is after PDR, so we still do have that 7 million that we set aside in 16 coming in to help offset. If we did not have that 7 million in here, we really would be at a $3 million loss. But as I shared, when we were here in the spring, we had a lot of initiatives that we were putting in place to really try and look at how we could reduce admin, reduce medical claims costs, increase revenue. We have been working diligently on those. That's factoring into some of the positive results that we're seeing. And we are continuing to keep our foot on the gas and move forward with those initiatives. Our goal is to close the year with a net positive rather than the deficit budget that we had brought forward and was approved for 2017.
Mr. Chair, could you explain that 7 million thing
Yep.
again?
So as we closed out 2016, we were looking ahead, doing our forecast for 2017, and we were making the projection that our 2017 rates were going to be insufficient to cover our costs. So under the insurance rules, if we know that the premiums per se are not going to cover the costs, you need to establish a premium deficiency reserve. So what we did was took 7 million out of our income for 2016 and reserved that to offset losses that we were anticipating in 17. And so 1/12 of that is brought in throughout 17. So of that 7 million, 1/12 each month is brought in. The positive that as we look at the rates for 2018 is we will not need to establish a premium deficiency reserve for 17, for 18, and we do feel that we will, we've not completed our budget yet for 18, but based on kind of our early projections, we anticipate having a net profit in 2018. So still not exactly where we'd like it to be, but definitely moving in the right direction.
Mr. Chair, I've been on the finance committee for like 7-8 years now, and I still, insurance accounting is a complicated business.
Very,
And
very
it's all,
volatile.
it's all actuarially determined on and then regulated to be accounted for in certain ways that are hard to understand sometimes. And then you throw in the component of DHS setting our rates and determining that, and that kind of being lag time based on claims that we have, and it's a lot.
Lots of estimates. We estimate what our membership will be, we estimate what the mix of that membership will be. Yeah. So, did that help?
Yep, thank
Okay,
you.
You're welcome. So, any other questions on the finances? We'll keep heading in that direction. And then lastly, I just wanted to touch on, over the last several years, you know that I have been working to try and build our awareness and relationships with our state legislative community. We had really never done anything at the federal level as far as kind of any federal engagement in education. And our board had approved earlier this year to work with Lockridge, Grindle, and Noun. It's a firm that we had worked with before, to really look at starting to do some federal engagement. So we had a group of individuals that made a trip out to Washington, D.C. in July. Really, it was that piece to kind of advocate, to help educate about county-based purchasing. With all of the disruption that there is in healthcare right now, and knowing that changes are coming, but not what they're going to be, we really wanted to have that message of whatever happens, please make sure that there's still a place for local, regional health plans such as South Country Health Alliance, where there's that local authority and decision making, and to really start to build those relationships for the future. So we took a team out there. It included several of our commissioners, Jackie Ock, the HHS director from,
I think there's supposed to be a picture, but maybe it didn't.
it's supposed to be words, the team. So Jackie Ock from Todd County, the HHS director, a couple of our staff, and 2 representatives from Lockridge.
Oh,
That's
Well-
just weird.
just messing with you, I guess. Sorry about that.
So who did we meet with? And we lost the screen.
Who did we meet with?
There you go.
We did not.
Was it?
Yeah.
Oh, it's good here. Well, oh, yeah, no, I don't know why I did that.
But we did have a very busy kind of day and a half while we were out there. We had the opportunity to meet with staff from the Center for Medicaid and Medicaid Services, Medicare and Medicaid Services, both from Baltimore, and they had several people on the line from the regional office in Chicago that we work with. We met with a number of our congressmen. You can move it to the next slide, please. A number of our congressmen and staff, and then also staff from some of the congressmen and delegation that does not represent South Country service area, but represents Minnesota. And by and large, what we really found is that the model, as we described it, I think is recognized as being a good model for rural Minnesota and very respective. We heard lots of comments of, why aren't we doing more of this? And those types of things. Really a recognition that Minnesota has been a leader in innovation and outstanding healthcare, and we shouldn't take that for granted. And the message that we heard often is the work that South Country and county-based purchasing plans are doing is good work, and we need to be proud and be bold. I think it's that piece that we've talked about, that we know sometimes we just don't celebrate ourselves enough, and we kind of just take it for granted that what we do isn't extra special because it's just how we do it. It's part of our model, and it's just the way we operate, but that many others don't, and so we need to tell that story. So we are going to continue to work on that effort and to tell our story and to try and highlight our successes. We're preparing and kind of gearing up, starting to schedule some things and make sure that we're connecting again at the state level. Yesterday, Commissioner Johnson joined me, and the county-based purchasing plans had a meeting with Lauren Gilchrist from the governor's office and Assistant Commissioner Nathan Morocco from DHS. Again, to just talk about county-based purchasing as a model and the successes that we've had and where this model fits in healthcare reform as the state is looking at it. And again, making sure that, we have a voice and we're at the table. We'll also continue those federal efforts. I have a conference that I'm attending in DC in November, and so I'm gonna travel out a day early, and I'm setting up meetings to again meet with some of our congressional delegation while I'm out there. So we're gonna continue those efforts to be in front of them and to share the stories of our successes of county-based purchasing and make sure that it is recognized as a true reform model that benefits rural counties.
Good. Thank you very much for the good job.
Mr. Chair, in Leota, yesterday with the governor's office, they were, of the grants that go back into the counties, they had questions on that, So, I mean, that's good. It's out there to improve health, so.
I think one of the things that wasn't really recognized is, I think there's been a kind of this perception of the community reinvestment grants. I think the awareness was really raised yesterday that those community reinvestment grants are really about increasing access and helping to fill some of the gaps in rural communities. And we talked about the Apple Tear Tree Dental Program outreach clinic that's been established in Morrison County and growing to that. Grant dollars that were used to establish a mental health program in Wabasha County, which had no mental health services in their county prior to that. And so really tried to highlight some of those examples.
Mr. Chair, I have one question for Leota. Early on, if I understood it right, we have South Country service 19.5% of the population.
Yes.
In Morrison County.
Correct.
In the real world, no, in a fantasy world perhaps, we would like to see that at 100%. My question is 19% where we're happy with being? Should we be happy with that, or, and I know that the law changed early on.
So it's
I
not
got that.
19.5% of the people that are eligible, it's 19.5% of the entire population. And so that's 19.5% of the
Morrison
entire
County.
population of Morrison
Yeah.
County that has South Country Health Alliance for insurance because of either an income qualifier. So we wouldn't want it necessarily at 100% because we want private insurance to fund and we want employers to.
That's my question. Is 19%, is 20% where we want to be?
Actually, it's probably high.
Yeah.
Oh,
What you look
there we
at
go.
is,
Yeah.
There we go.
what that represents is the number of individuals living in your county that are low income.
Gotcha.
Yeah.
And so
Yeah.
therefore
Thank you.
are
Thank
qualifying
you.
for Minnesota
Very
healthcare
clear.
If it
programs.
was 100% or 80%,
It would be,
poverty.
yep,
Yeah.
gotcha. Very good.
If you're in the
That's
hole,
what
then you're really in
I
the
just
hole.
wanted to check that. Very good.
Okay.
Now,
Does anybody else have any
Any other
questions?
questions?
If not, I thank you very much.
Thank you for
Thank
coming.
you.
So much.
thank you.
And I will just
Oh,
leave
perfect.
these as
Thank
a
you,
reference document for you.
Okay,
See you next month.
Next, we will have sheriff's report. Sean, Commissioner.
Morning, Sheriff.
Morning,
Chair, members of the board. I'm Deb, Tabitha. So I'm here today just requesting approval for a full-time records technician for the sheriff's office. Basically, we did a presentation at our budget meeting and then again last week at our planning meeting. And then we also brought in our administrative support supervisor, Mary Swenson, last week. And we talked about the lengthy training involved and the necessity for the position. And then we also discussed as well as how we adjusted our sheriff's office budget by $46,500 to offset these costs for the position. So,
Mr. Chair, I'm going to move on this.
Second.
Got a motion by Commissioner Jelinski, seconded by Commissioner Lemire. Any further discussion?
Again, we beat this pretty good on last Tuesday at the planning meeting. Sheriff brought a lot of good information, Mary did. And like I say, based on what I see, we just can't hire a temporary person of all the requirements that this person would need. And I think moving forward, I'd be all for this one too, so.
I guess in my eyes, you brought forth that we're about a year behind on getting caught up with record keeping and stuff like that, getting everything entered. And there's more deputies, there's more of everything going on that's got to go through their offices. And to take up that salary, you did cut your, I won't say cut your budget, you took it out of other areas of your budget so that this is about a $10,000 increase, I think.
it's actually $8,000.
$8,000. So, just for the clarification that we talked about all that at the planning session, so. Any other questions? If not, we have a motion and a second. All in favor signify by saying aye.
Aye.
Opposed? Motion carries.
Thank you, gentlemen.
Thank you.
Thank you, Sheriff. I
Okay,
think it's time.
oh, we need a 5-minute break, I guess.
Absolutely.
Thank you. Back to business here.
Just read these two.
Public Works, public hearing today. Steve?
Mr. Chairman, it was back in 2016
Correct.
that the board, after providing evidence to the board, you authorized the department to do a cleanup of a piece of property under our solid waste ordinance. So Chuck will go through what we did and what the costs are in this hearing is to assess that cleanup cost.
Okay.
Good morning, Commissioners.
Good morning.
County staff, guests. I do have a resolution. The resolution is for notice of a special assessment, and we need to have that in prior to November to be put on the books for the upcoming years. So the resolution in part reads, whereas on May 10th, 2016, the Morrison County Board of Commissioners authorized the Public Works Department to remove solid waste from the property described below, to bill the property owners for removal and disposal, and to apply a special assessment against the property if the cleanup bills are not paid. Now therefore be it resolved, the Public Works Director of Morrison County requests that $254.70 be assessed and charged on the tax roll against the above described property, where if the assessment is not paid by December 31st, 2017, accrued interest will be charged at a rate of 10% with a 10% penalty. If payment is not received by November 15th, 2018, the amount listed above will be collected over a 2-year period with interest added at 10% per year on the unpaid balance.
Okay. Is there any, I gotta ask 3 times, is there any public comment?
So we'll open a public hearing at this point in time, and then we'll ask
Okay.
for public comment.
So the public meeting is open. Is there any public comment on this? Is there any public comment? Is there any public comment? Hearing none, we close the public hearing.
Yep.
And can I get a motion?
I'll make a motion for more discussion.
Second.
Got a motion by Commissioner Wincher, seconded by Commissioner Johnson. Any further discussion?
Question, does someone monitor this, Chuck? If, now it's been, a couple of years since we've cleaned it up, so it doesn't, do we kind of remind this person, that, hey, you're getting there, or is it nice and clean again, so?
Well, it hasn't really gotten any better. There isn't really a protocol for really monitoring, however,
Okay.
I do drive by there twice a day. I sometimes will take a right-hand turn and make the circle. I do get input from the neighbors frequently. I know the neighborhood as a township official. I do get a lot of feedback. So, I mean, I do have a method of monitoring, but it's not an established protocol, so.
There's a substantial amount of effort that goes in before we even present the evidence to the board to do the cleanup, because it's not really something we want to have to go through. It's not a lot of money in this case, but we try not to be excessive when we do something like this. So we utilize sentence to serve, we cleaned up $250, most of that being landfill costs. Can get rid of quite a bit of garbage. But once it's cleaned up, we're starting over. And so if you know, folks, if whoever we're dealing with continues to create the same situation, we probably be back in here again or use another alternative route to get compliance.
And if I may, Mr. Chair, I've got a few phone calls from the residents of that area, and I refer them to Chuck, you know, so if they have any challenges or whatever, that's what I do. And I don't know if that's the correct protocol or not.
Okay. Anybody got any more questions? If not, this is a roll call. Commissioner Lemire?
Aye.
Commissioner Winchard?
Aye.
Commissioner Jelinski?
Aye.
Commissioner Johnson?
Aye.
And aye.
Thank you.
Welcome. Thank you both.
Thank you.
Okay, social service report, Brad.
Good morning, Mr. Chair, Commissioners. For my first item, I have a couple of guests. Only
morning,
one is
Brad.
listed, but I will bring them both up. Come on up. So as you might recall, TRICAP is our public and volunteer driver program here in Morrison County. And so I've asked Lori to put together a presentation and some information about the services they provided and how much of those services they provided. So I will turn it over to you, and maybe Brian, if you could introduce yourself.
Yeah, my name is Brian Horn. I'm the Transportation Director for TRICAP. Began working with TRICAP in October of last year.
Well, good morning, everybody.
Good morning.
It's good to be back here in front of the group. Thanks for having me. We wanted to come and just share a little bit about what's been happening with public transit services and the volunteer driver program services that TRICAP operates over the last year. So as Brad alluded to, we are the public transit provider here in Morrison County. We also provide public transit in Stearns, Benton, and Sherburne counties as well. In Morrison County, we have four fully accessible buses that we use. We have 3 dedicated buses that are in the city of Little Falls, primarily Monday through Friday, with the exception of an expansion project that I'm going to talk about in a little bit. Our public transit services are for everybody in Morrison County, in the service area that we provide the transit. So what I mean by that is our fares are $1.25 per one-way ride for in-city service and $3 for rural service. So there are no income eligibility guidelines. If you want to ride the bus here in Little Falls and it meets the service times that we offer, we'd love to have you ride our bus. Last year, we provided 27,809 rides in Morrison County, which was an increase of just a little over 300 rides from 2015. Right now, our estimates show that for 2017, we will be up over 30,000 rides in Morrison County. So that's great, because when I came here last year and spoke with you, I talked about one of our goals was to increase the number of rides that we were providing in Morrison County, and I'm really happy to report that we've done that. So we are what we call a dial-a-ride curb-to-curb service. So what that means is all of our riders call into our dispatch center that's located in Waite Park, and they talk to our dispatch about where they are located, where they need to go, what time they need to be picked up. Our dispatch staff, of course, ask them if they have any accessibility needs so that we are fully prepared when we go to pick up that passenger to get them safely where they need to go. We do some deviated route service, and what deviated route service means is that we have, for example, contracts with local partners such as employment enterprises, where we do a lot of the public transportation for their clients to get them to and from their work sites. So deviated service would mean if we're on that contracted route, we will pick up people along the way as well that need a ride within the vicinity that we're in. We do have a route that every month, it's the fourth Monday of the month, that travels from Little Falls into Royalton and then into St. Cloud for a few hours and then comes back to St. Cloud. To Little Falls. That's been a good route. It's had some high ridership consistently over the years. And then we also have service that goes into Piers, and I believe that's 1 day a week
Every Friday.
that we do that route as well. Some of the highlights of this last year, other than the number of rides we provided, we did do a service design change last year, which we shortened up the span of what the city service routing would be. And that's so our buses were being more efficient in the city of Little Falls. It's very stretched out. And so what we don't want to do is act like a taxi cab service. We want to be very strategic in picking up groups of people in like areas and getting them where they need to be. We also started a service pilot expansion on July 1st, where we expanded our hours here in the Little Falls area from 6 a.m. to 6 p.m. We were typically about 7:45 in the morning till 4:30 in the afternoon prior to that. And we also started a Saturday service from 8 to 4 here. And the numbers, I'll let Brian share what those numbers are, have been good, to start, considering it's new and people need time to get used to knowing that our public transit is available more than what we normally have been.
Yeah, so as Lori had indicated, the service expansion, the 6 a.m. to 7 a.m. is new. We're trying to capture some more commuter customers, and then we expanded from 5 p.m. to 6 p.m. Those are the 2 hours Monday through Friday that we added to the service during the weekdays. In July, on July 1st, our service began. We had 19 customers that fell within those 2-hour periods during the day. August was 37, and then September was 44. So we're seeing some steady growth, and as public awareness increases, ridership, I believe, will increase. It provides an opportunity for folks that haven't had access to public transportation for those times of the day. So we've been pretty excited about that. The other piece would be our Saturday service. In July, again, we're talking just on Saturdays, 8 hours a day, 8 to 4 basically is the service that we provide. We had 78 past one-way rides in July, and then in August we had 69, but then in September it bounced back with 113. And I can tell you that last Saturday in Little Falls, we had 28 just in the 8-hour period. So we're seeing some growth as awareness becomes more available and people are getting familiar with that service. So we're excited about the opportunities and the growth that we've seen.
One of the other highlights for the upcoming year is TRICAP will be building a new transit facility at our current location, which is right outside of town. This location will have a 6-stall facility. It will also have an outreach office and conference center for community meetings, as we are the energy assistance provider here too. So my goal is to eventually have an energy intake worker that is physically in Morrison County to see Morrison County residents and help them with their energy assistance application, as well as build a transit facility that we need to continue to grow our services in this area. The other, sorry, did you say something? Okay. The other program, of course, that we operate here is the volunteer driver program. And the volunteer driver program is an avenue that we have volunteer drivers that use their personal vehicles to transport TRICAP clients, mostly to and from medical appointments, social service types of appointments, where public transit isn't an option. We always try to use the public bus if at all possible because it's more cost effective. This last year, in 2016, we provided 5,154 rides through our volunteer driver program, and that's primarily through a contract with Morrison County as well as South Country Health Alliance. We have a contract with that organization as well to provide those rides. Which 5,100 is an increase from 2015. I'm not exactly sure. Brian, can you tell us about how much increase that was?
Well, 2015, I've got to do some math. We got primary
Sure.
passengers.
I
I don't want to misquote. I got 5549 is what I'm showing
Okay.
on this report for 2015 for volunteer drivers, and for 2016, 5154.
Right, and what are we
then
estimating
We're
for this year?
forecasting for 17, 5,700
Okay.
one-way rides. So we're showing some growth there.
One of the challenges that we've had, specifically in Morrison County, is being able to retain and have enough volunteer drivers, specifically volunteer drivers that are able and willing to transport clients early in the morning. Let's say they have appointments, they're going to the Mayo Clinic in Rochester and they have to leave at 4:30, 4:45 in the morning, or later in the evening or during winter months. These are volunteers, they're not employees, and so we, of course, try to honor their requests as much as possible. So we've really enhanced our marketing efforts in Morrison County to recruit more volunteer drivers, so we are ensuring that we are able to meet all the ride requests that are made to us by the county and by South Country Health Alliance now and into the future.
Mr. Chair, Lori, if I may, when we're talking about a volunteer driver, and let's assume I want to go to Rochester today because I have an appointment at 10 o'clock. I can make a phone call. I'm anticipating there's going to be a cost to me right off the bat. Can you elaborate on that, first of all?
Sure. How it works is all of the volunteer driver rides that we provide are through a contract, either with Morrison County or with South Country Health Alliance.
Okay.
And so these are all individuals that have caseworkers, social workers of some type.
Sure.
And so they're working with their provider, establishing what those required rides are. So the ride requests actually come in from the workers in Morrison County or from South Country Health Alliance that tell us where this passenger needs to be.
So in that case,
There is no
I-
cost.
I have to be in the system, though, if you will.
Correct.
Okay, good
Yeah,
enough.
yeah,
Good enough.
yes.
Very good.
So there's no cost to the recipient,
Yep.
but they
Understood.
will have to either be on medical assistance or have a case manager.
Very good.
And you're paying mileage, I presume, to the volunteer.
Yep.
Yes, what we provide for our volunteer drivers is we do a mileage reimbursement at the IRS recommended rate.
Yep.
They also get a $4 a day startup fee. So any days that they're actually driving consumers, they get that $4. And then if they have to be gone over the mealtime, we will provide a meal reimbursement. And then if they have any parking fees, so they're in paid parking areas, we will reimburse them for that as well. We offer annual training to our volunteer drivers because sometimes they do transport young children, so we provide car seats, we provide car seat safety training, defensive driving, we offer first aid CPR courses, everything to equip those volunteer drivers to be able to handle situations that may arise when they are transporting clients.
Mr. Chair, if I may, if I want to become a volunteer, do I have requirements? Obviously, I need a driver's license and all that stuff, but otherwise I can just say, hey, I want to volunteer, and you'll let me volunteer?
There are some requirements because we do want to protect all of the parties involved, and so some of those requirements, there is an age requirement. There is also, we do a background study check on all of our volunteer drivers. We do a driving records check, and there are certain convictions that will prohibit folks from being volunteer drivers. We also have to have a car inspection report done to ensure that the vehicle that the volunteer drivers are using is safe and in sound condition. And then there is also a medical provider form that we also have them submit to their physicians that just tells us that they are fit and able to be a volunteer driver.
But if that's an offer, we're gladly accepting all
Absolutely.
takers.
He's got a sidecar for his Harley.
Yeah, put it on a motorcycle.
But you do meet the age requirements, Commissioner.
Okay, I
So-
knew I wasn't even going to the age requirement.
You know, a lot of our volunteer drivers are retired individuals that, want to give back to the community. The anecdotal information that we get from our volunteer drivers is, it just adds to the value of their life. They enjoy doing it. And for some, it's really a supplement for them, an income supplement. So it's really a win-win situation. They've got time to be able to do it, and it provides a valuable service in the community. That's just a few of the highlights of our two different types of transportation programs that we have in Morrison County. I did provide in the board packet as well, because I always think it's important for the public entity to know our geographic location of where we offer services in Morrison County. And all of the residents can find this information on our website. We recently updated our website. It's nice and handy dandy if you're technology not as good as like me, and so you can click on a button if you want to see what transit services are available in Morrison County. Our dispatch staff are always happy to talk with customers as well about questions that they have, help them navigate their transit needs, whether TRICAP can provide it or if there are other types of services that would help them. The other component that I added is an economic impact report. And I always like to show this to the public within the counties. TRICAP is all about helping people and meet their basic needs, and we do that. But we also have an economic impact on the counties in which we serve. So last year, for example, in Morrison County alone, $876,000 went back to local energy providers in Morrison County through the Energy Assistance Program. 21,770 went to local contractors that were out in homes in Morrison County doing furnace replacement and repair assistance. We had some new development construction payments that were made to construction companies for some of the new construction that we had done in other counties, but used Morrison County contractors to do that. And I won't go through all these, but overall, $936,000 went back into this community, stemming from the services that TRICAP provided in this area. We partner, of course, with Tri-County Community Action Partnership, which is TCC, which is located here in Little Falls. They are actually your federally designated community action agency, and we work very closely with them to ensure that the Morrison County needs are met. Questions?
And I'll just add, in terms of the transportation needs within Morrison County, you as commissioners and we as an agency do support transportation. We give them a subsidy for the public transit, as well as we will subsidize disabled and elderly tokens. They can come to our office and purchase tokens at a reduced cost if you're elderly or disabled. And we go through quite a few tokens. Last summer, we were running out quite a bit of tokens, and so we try to support public transit as much as we can, and thanks to the support of the board, we are able to do that. So it's a critical service, both in terms of just around the community as well as accessing St. Cloud or peers, so.
That's a wonderful service that you provide to your residents by having those reduced fare tokens. In fact, I talk to the other counties that we work with, and I tell them about what Morrison County is doing, because it certainly does have an impact, especially on the seniors and the folks that are have some disabilities, to help them get where they need to be for their quality of life.
Yep.
Mr. Chair, I would just like to compliment the agency. I think it's a wonderful deal that you do here. For the people that utilize the system, I think it's phenomenal. And I really think that, to take a look at the dollar figure here, and there's $1 million that's brought back into the community, cycled around, that's $1 million that wouldn't have to be here. And it's $1 million, so it's a big deal, I think. So thank you very much for what you do.
Thank you.
Thank you.
Good information,
Thanks,
thank
Brian.
you.
Have a good
Thank you
day.
very much. Sorry for the wait.
Oh, not a problem.
All right, I have a couple of other items under, one other item under social services, if I may. We are creating a contract with Mid-Minnesota Drug Testing Company here in Little Falls. We've been using them for quite some time. Now that we have a regional contract manager, we're formalizing more of the services that we're using. So I'm requesting approval of a contract between Mid-Minnesota Drug Testing and our agency for services that we are using and have been budgeted for. And the county attorney did review the contract.
So move. Second.
Got a motion by Commissioner Johnson, seconded by Commissioner Lemire. Is there any further discussion? If not, all in favor signify by saying aye.
Aye.
Opposed, motion carries.
Thank you. I will now move to the public health report, and the first item under that is a request to replace a public health nurse who is leaving our agency. This is a position that was .8. It was hired actually last year about this time. Was hired at a full-time, dropped to a .8 sometime last year. I'd like to request that we replace it with a full-time equivalent. I think it's a little easier to hire a full-time equivalent as well as the services that we're providing. We have increased the budget to reflect the changes. There should be more ability to do some maternal child health visits that will increase insurance revenue. And this will require a nurse in this position, given the duties that it involves. As a result, we know what the challenges we've had recruiting some nurses to work for public health, so we are requesting with this motion to deviate from our compensation plan and possibly hire at a higher step right off the bat.
I'll make a motion to
Got a
approve, Mr.
motion
Chair.
by Commissioner Lemire,
Second.
seconded by Commissioner Wincher. Is there any further discussion?
Just, Mr. Chair, and Brad, correct me if I'm wrong, this position was hired at full-time
Correct.
originally, then the person that is leaving now requested to lower it to .8, which we obliged.
Yes.
And now we're just going back to where we started.
Correct. Yes, sir.
Any other
And
discussion?
Mr. Chair, just like to make a comment that public health, first of all, is public health. We're talking about children here, that this is just something that goes without saying as far as I'm concerned, so I fully will support this.
Well, we're required to have a nurse on staff.
Yep.
So, okay, all in favor signify by saying aye.
Aye.
Opposed, motion carries.
Thank you. The next item under public health is approval of an emergency environmental health services contract between our agency and Stearns County. This is a contract that has been in place for the last 4 years. It is now an update because it ends at this year. This contract will not actually have an end date. The cost of the contract remains the same. We do have our own environmental health services. However, there are situations where we may not be able to respond to an emergency. We did have one actually a couple weeks ago when our person was out of the office, and so I actually can't remember if it was Stearns or another county, but we have a couple of these contracts in place to ensure that we are meeting the needs of our providers. So this is an update to an existing contract with no expiration date.
So moved.
Second.
Motion by Commissioner Wincher, seconded by Commissioner Jelinski. Is there any further questions? Not all in favor signify by saying aye.
Aye.
Opposed, motion carries.
The next thing I have is under Public Health and Social Services, and this is a position that we've talked about during the transition of Public Health to a Director with Social Services, as well as discussions in our budget meetings around creating a Human Services Supervisor position that will be shared by Public Health and Social Services. The previous supervisor, there was a supervisor in Public Health who has left the agency and is now working for a regional entity. So we are taking the point forward that person was employed and increasing it to a full-time supervisor position, helping to bridge that gap between public health and social services, as well as to align some program and staff areas, so to assist us in meeting the mandates and the requirements. So this position is really funded based on prior supervisors as well as the public health director's salary. We are also putting it under the merit system so that there will be some revenue under the social service part of this position, and it will actually be employed by social services because of the reimbursement process within our agency. We have had this position graded by Triad HR Consulting, so it would be created as a grade 32. And this position, as I said, will will supervise staff from both public health and social services. We're looking at those services that we work with in terms of the hospital, the State Innovation Model Grant, those services provided by South Country Health Alliance, In Care Coordination, and Minnesota Choices, as well as community health and environmental health services. So I'd ask for permission to create this position under grade 32 as a human services supervisor.
Got a motion by Commissioner Lemire, seconded by
I'll second it.
Commissioner Jelinski. Is there any further discussion?
Mr. Chair? Brad, where does the money come from for this?
This money, we currently had the .4 position from public health.
Yep.
As well as some of the money that we are saving by not replacing a public health director. And overall, we are not using all of the funds from the public health director position in replacing some of the areas that will help cover both organizations. So
it's there.
And it is money that is also in our 2018, it is budgeted for in 2018 as well during that budgeting process.
And we've had working sessions that we've discussed a lot of this in depth, so. Okay, all in favor signify by saying aye.
Aye.
Opposed, motion carries.
I think that's all I have. Thank you.
Thank you, Brett.
Thanks, Brad.
Thank you, Brad.
Can I have my cord back?
You can.
Land Services, Amy.
Morning, Amy.
Good morning, Miss Amy.
It is still
I
morning,
just don't,
so don't take us into.
That's
noon.
right. You got 5 minutes.
Well, I've been allotted 1 minute per item,
Yes,
so.
there you go.
that's good.
Chop, chop.
All right. First item I have is an agreement to provide professional advanced inspector services in Morrison County. This would be provided by Stearns County. This is the third time we've entered into this contract. And really essentially what this does is if we get a septic system design that requires an advanced septic system inspector, which we do not have on staff, we would rely on the services of this contract through Stearns County to provide septic design review and then also septic install inspection. The reason why we don't have that on staff is we simply do not have these systems very often in our county. In the 4 years that we've been contracting with Stearns, we have not had one. We have not needed to utilize this contract once. However, we do have that, we do need to provide that service when we're called to, and so this is a contract in place to help with that. The county attorney has reviewed this, has no issues with it. This is there is no end, the term of this contract, there is no end date. However, it does allow an annual review and changes if needed.
So moved.
Got a motion by
Second.
Commissioner Wincher, seconded by Commissioner Lemire. Is there any further discussion? If not, all in favor signify by saying aye.
Aye.
Opposed? Motion carries.
Okay, thank you. All right, the next item I have is to consider the conditional use permit, a request from Dwayne and Jane Lang. And this is to expand to a Tier 2 swine feedlot. The Planning Commission did hear this at their September 25th meeting, recommended approval with 5 conditions. And those conditions were to abide by local and state law, notify road authority when hauling manure during road restrictions, abide by the submitted good neighbor, stormwater, and feedlot odor minimization plans. An acceptable composting facility must be constructed and used, or a rendering company must be utilized for mortalities prior to stocking the barn addition. And plant and maintain a 50-foot wide grass buffer around the perimeter of the barns after construction for ongoing stormwater management as shown within the environmental review.
I would so move on that, Mr. Chair.
Got a motion by Commissioner Johnson, seconded
Second.
by Commissioner Lemire. Is there any further discussion? If not, all in favor signify by saying aye.
Aye.
Opposed? Motion carries.
All right, thank you. The next item is to consider the conditional use permit request from Jeremy and Jessica Lucking. This is to expand to a Tier 2 poultry feedlot. This also was heard by the Planning Commission on September 25th and recommended for approval with 4 conditions. And those conditions are to abide by local and state law, notify road authority when hauling manure during road restrictions, abide by the good neighbor, stormwater, and feedlot odor minimization plans, and plant and maintain a 50-foot wide grass buffer around the perimeter of the barns after construction for ongoing stormwater management as shown within the environmental review.
So moved with more discussion.
Got a motion by Commissioner Wincher, seconded by Commissioner Lemire.
Amy, could you help me out? Why is the fourth condition on the screen?
Why is it?
Because you said four conditions, there's
Hold on a
five
minute.
conditions.
Wait, probably operator error.
I know, that's why I want to make sure.
I may or may not be.
It's not even the
What-
same.
Looking,
That's why I brought it up. It's like we're,
Sorry, Amy.
okay, we're
Sorry,
good.
there we
Commissioners.
go.
All right.
My scrolling finger
Okay,
took
any
a
further
break.
discussion? If not, all in favor signify by saying aye.
Aye.
Opposed, motion carries.
All right, thank you. The next item is to consider the conditional use permit request for Jerry Malinowski. And this is also to expand to a Tier 2 poultry feedlot. This also was recommended for approval by the Planning Commission with 5 conditions. So we're back to 5 now. And those conditions are abide by local and state law, notify road authority when hauling manure during road restrictions, abide by the good neighbor, stormwater and feedlot odor minimization plans, plant and maintain a 50-foot wide grass buffer around the perimeter of the barns after construction for ongoing stormwater management as shown within the environmental review, and the property owner shall notify the feedlot officer at the time of barn cleanouts.
I'll make a motion, Mr.
Got a
Chair.
motion by Commissioner Lemire, seconded by Commissioner Johnson. Is there any further discussion? If not, all in favor signify by saying aye.
Aye.
Opposed, motion carries.
All right, thank you. And the last item I have is to consider the conditional use permit request for Jeffrey and Michelle Young. And this is also to expand to a Tier 2 poultry feedlot. Recommended approval by the Planning Commission at their last hearing. And this is recommended with 6 conditions. The first one, abide by local and state law. Notify road authority when hauling manure during road restrictions. Abide by the good neighbor, stormwater, and feedlot odor minimization plans. A stacking slab must be constructed prior to stocking the barn. Plant and maintain a grass buffer around the perimeter of the barns after construction for ongoing stormwater management, as shown within the environmental review. And the property owner shall notify the feedlot officer of all manure transfers.
Did I get a motion on that?
I'll make a motion, Mr. Chair.
Motion by Commissioner Lemire.
Second.
Seconded by Commissioner Johnson. Any further discussion? If not, all in favor signify by saying aye.
Aye.
Opposed, motion carries.
All right, that's all I have for you.
Thanks, Amy.
Thank
Thank
you.
you very kindly.
Mr. Chair, I'll start with
Oh, that's right, we got the auditor.
Are you next on the agenda?
No, but I'm gonna fill in. I think Steve might be coming in, but, he's not here yet. But there are a number of action items that Deb Lau submitted for consideration. The first is to address the Minnesota Trail Assistance Program Agreement for 2018 for the Morrison County Recreational Trails Association for the snowmobile trails. So this is an annual, pass-through, really is what it is with the Trail
I'll move on
Association.
it.
Got a
Second.
motion by Commissioner Jelinski, seconded by Commissioner Wincher. Any further discussion? If none, all in favor signify by saying aye.
Aye.
Opposed, motion carries.
Thank you. The next one is the agreement with the county and the Eastern Morrison County Four-Wheeler Club. So we're a sponsor for that agency. Also, again, it's pass-through dollars that come through that we are the entity.
So moved.
Second.
Motion by Commissioner Wincher, seconded by Commissioner Johnson. Any further discussion?
Mr. Chair, these people, like the snowmobile people, do a lot of good for the county and a lot of good for our trails.
Good. Anybody else? If not, all in favor signify by saying aye.
Aye.
Opposed? Motion carries.
Thank you. There are a couple of permits. One is the Royals Wrestling Club. They're holding a raffle on August 3rd at Pine Ridge Golf Club. And the other one is the Big Lake Sportsman's Golf Club to hold a raffle on November 25th
So
at Stone
moved.
Hill Bar and
Second.
Grill.
We got a motion by Commissioner Johnson. Who made that second? Second by Commissioner Wincher. Any further discussion? If not, all in favor signify by saying aye.
Aye.
Opposed? Motion carries.
There is an exempt permit request for Horizon Health to hold a raffle on November 17th at the ballroom.
So moved.
Got a motion by
Second.
Commissioner Jelinski, seconded by Commissioner Lemire. Any further discussion? If none, all in favor signify by saying aye.
Aye.
Opposed? Motion carries.
And as if by on cue, Steve Messerschmidt just walked in the room and he presented the cash report. We already got most of the approvals done, so thanks But if you have questions for him on that, he will address those because he's very smart and good at his work.
Good morning, Steve.
Good morning. I don't have anything, I just need form signed, I think, in here. I think there's a one.
For all of them, yeah, for the approvals.
And I think this one here too.
No districts in county board warrants yet.
And I think that's it.
All right, thanks.
I don't-
Job well done.
Unless you have questions.
Hey, thanks, Steve.
Thank you, Steve. Have a good day.
I'll stay here for a while.
Mr. Chair, we have the warrants that need to be approved.
I would so move on the warrants, all of
We
them.
have a motion by Commissioner Johnson, seconded by
Second.
Commissioner Lemire. Is there any further discussion? If not, all in favor,
No
signify.
roll call vote.
Okay, that's right. Commissioner Lemire.
Aye.
Commissioner Wincher.
Aye.
Commissioner Jelinski.
Aye.
Commissioner Johnson.
Aye.
And aye. I'll know that by January.
Perfect.
Good for
We
you.
hope so.
You might not. Just always-
Then it won't matter.
That's right.
Mr. Bukowski, I believe, is next.
That's it for auditor's report?
It is, thank you very much.
Okay. Let me see, we got the warrants, we got Public Works.
Mr. Chairman, members of the board, in May of this year, we entered into a contract with Ameribuilt Buildings to construct a warm storage building at the Piers facility. The work has been completed, and we are recommending and asking the board to adopt the final certification so we can move forward with filing the project.
Can I get a motion on that?
So,
Second.
We got a motion by Commissioner Jelinski, seconded by Commissioner Lemire. Is there any further discussion? If not, this is roll call. Commissioner Johnson.
Aye.
Commissioner Jelinski.
Aye.
Commissioner Wincher.
Aye.
Commissioner Lemire.
Aye.
And aye.
That's all I have.
Thanks, Steve.
Steve, thank you very much.
Okay, next we have building project update.
Yes, Mr. Chair, we have our friends from
Friends
our
are
architecture
friends.
firm and our construction company here to give you an update and to set some dates about work moving forward. Give that to you last night. Okay, now, technically Deb is going to try to do this for Steve.
Good morning.
Good morning.
Pete picked us over North Dakota. I thought you were in North Dakota.
Well,
I mean, good choice.
yeah, good choice, exactly.
Close to home.
That was a quick last minute change on Sunday.
Good.
All right, where are we?
Does that mean we got troubles and we needed you, or?
No, I was called a tweaked back and had a pretty good workload yesterday, and I thought, well, I'll send my brother Mike to sit in the car for 5 hours, so.
You're not pheasant hunting. I thought you'd be pheasant hunting.
No, actually, North Dakota has their, like AMC we do. They had their deal out in Bismarck yesterday, and
okay.
so,
All right.
yep.
Sure, try that. There you go.
Okay, great.
All right.
I think we're all set.
Yep,
Thank you.
you just go ahead.
Good time for me to say thank you again for allowing us to serve you in the capacity as your architect on this project today, or this week and this month kind of represent a little bit of a change. Our work, as you know, has been intense in the design and the planning with you. We'll still be involved over the next couple of years or so, but now Contegrity's group's work is ramping up, so we're kind of crossing over this month as we coordinate, look over the plans, and get them out for bids, and Pete will talk about that a little bit more. But we talked about a possibility of just giving you just a quick overview of where we're at. Now, I could have brought a stack of drawings about that thick, but this kind of meeting isn't conducive for going through those sorts of things. A printer will be printing a set within the next couple of days and sending it up to John's office. So if any of you are interested in just kind of looking through the plans and the specs to see what's there, that should be here fairly soon, in anticipation of a good period of time, as Pete will tell you later, that we're going to be looking them over before they go out for bids. There really hasn't been a great deal of changes to the plan since you've looked at it. A few minor things, again, as you can see, and I can't really point at this with a pointer because of the screen, but the tan areas are public areas. We have tried real hard to stay away from any kind of remodeling in those major 1990s lobbies. And we've made a few changes in the plans that have represented that, you know, kind of not moving doors and frames, because when you do, you're patching in a block wall and then you're changing the base. And the user groups have been pretty good about a few minor changes that help us in that regard. But again, the departments and the activities are all pretty much as they were in terms of where they are, with this lower level of the 1970s building still accommodating IT and probation. We've had structural engineers here now who have helped us with details of cutting through major concrete walls, such as up in that probation area up in the upper left. And those kinds of details have all been worked out now satisfactorily. Again, just for your review, county administration boardroom, social services down on that level. We've been using a number of 3D renderings to show things to staff, and some of you have seen some of these things as well, to bring a little bit more detail to it. We intend to do that even more by perhaps even a mock-up of some workstations and some things over this next few months or so. Auditor, treasurer, recorder, land services, all lined up as we had presented and talked about before, with a couple of conference rooms across the main lobby space. Over to the very right, you can see 2 pairs of pocket doors that have replaced a rolling grill that John didn't want to see at that location, or some doors that really kind of close that off, so that as one comes through that stairway out of the main lobby now, one will be able to look into the recorder's office, and then as those doors are 8 feet tall and very wide, it'll feel like you're going through a portal, not through a pair of doors. And that would be your view as you're coming to the top of the stairs, looking into that recorder's office. And again, that ability to see that there's activities there. What's missing from this rendering, obviously, is the signage that will help direct people where they need to go. Once around the corner and through that portal, they will see these public service counters laid out before them, with signage above them. These look a little bit dark. Keep in mind that gray ceiling is really going to be a white ceiling tile with light fixtures. And then just a little bit further in, you can see the makeup of the recorder's office, the auditor, treasurer, and land services beyond that, with each of them having a distinct and separate counter, with the front and back, all details now having been worked out for how the books go, how the cash register is set down, and the cash drawers and those sorts of things, how they're built in. Looking back again from the recorder's office to the backside of their counter, you can see that interaction, that visibility of the people coming and going, it goes to ease of use, it goes to security, that whole ability to be able to sort of see the surroundings and what's happening around. Front of the auditor treasurer's office with the staff towards the back there. That side of it, and you can see the opening up of this wall a little bit further down here with the glass that's going to bring natural light and views in for all the staff that are behind those counters lined up deeper in the building, and land services again on the back side. Over to the very left, you can see a counter. There are 2 of these that happen between these departments that are public service counters, but they're also lower, so that's going to solve the accessibility issues of all of those departments. A little bit different approach at motor vehicle. As you know, that's going to be in the 1960s building with its own separate entrance. That line that you see down through the lobby will be a rope. People will go to the left-hand side, queue up there, and then go to the first available workstation. There are 6 now instead of 7, so that other staff can come and be able to work the counter. Where you see testing, just south of that, again, there's a lower counter for wheelchair accessibility. And what's different about this department is that it's going to be constructed out of systems furniture. We don't have the cabinetry and the millwork in the drawings right now. We'll be working with you and staff later on to get the appropriate components in for more flexibility as that department probably threatens to change even just a little bit more than some of the others. So some views, again, looking from where they will work, being able to see people approach, queue up, and then promote the service of being able to get somebody to that first counter. And then, of course, the counters that will accommodate the vision check and the camera and those sorts of things. The vision check device is on a counter that will go up and down. So again, it'll serve the handicap by being able to lower it as you see it in the lower position in this particular drawing. As we go across that lobby that we don't want to touch, you can notice that the administrative offices are remaining pretty much as is. There's going to be some new carpeting. That mailroom is closed off at the very top of it. It's going to be flex space for a while. We've got O on there for office, but it probably will be conference. It'll be some other kinds of things that, as we see what happens over the next few years in terms of the election sorts of things, it's going to be nice to just sort of keep that. It'll be a good swing space, obviously, now as we get into the phasing, and so less work happening at that particular location.
And we did that intentionally, just because when we started talking about closing up that information booth and what that's going to cost, and then converting the space, if it was one bigger conference room, we'd have to have a double exit, and we ended up deciding that, you know what, let's just leave it for now, because there are too many unknowns with some other services, because we really struggled a little bit with how elections are going to evolve, and if there's more same-day registration, and this is a polling place, the traffic may be such that we want to utilize maybe a main floor, right by the door system that is servicing people we didn't know. So less cost going into it initially, because we just don't know what to expect.
And again, less work on that lobby, where anytime we do something, we're interrupting something that's a tile base or a block wall or something that requires fairly expensive patching. So really, the only thing that we're doing is we're taking out that display case right at the bottom of the stairs and replacing it with those doors and frames that will allow you to enter the waiting area for public health, VSO, and social services. And in fact, with some modifications we've made recently in the lower level, we planned a small display case down there. We're able now to accommodate a larger display case. We'll just take that same display case and move it directly downstairs and be able to reutilize it at that location. So plan hasn't changed a great deal here. You can see all the interview rooms. All of you know over the period of time that we've been working together about the whole concept of not allowing the public back into the work areas unless they're invited for some reason, but rather going to meet them at the interview rooms or going to meet clients at the WIC rooms and with public health, so that differentiation between public and private space and staffing workstations is holding true throughout this concept. Separate counters, again, a pretty consistent counter for public health and for social services, but they will be located, their primary staff will be located on one side or the other, with, again, a drop-down handicapped accessible station in the middle. The wood-colored panels it's cabinetry, but plastic laminate panels with some reveals to sort of break it up, and then that center part will be tile. We've gone through the finishes with the committee and have arrived at the carpet colors, the wall colors, vinyl wall fabric, and all those sorts of things that are now in the plans and specifications. But one of the things that, as you know, we dealt with in the design development phase was veteran services, and you can see now here in this rendering how it will have its own public service counter and its own entrance, and behind that a small waiting area in the staff area for people to be able to come in here. And then if for some reason that person isn't at that front counter, the person over in the very far social services area will be able to push a button and open the door and let those people into that waiting room, and then also alert the VSO staff that they've got somebody coming to see them. So it adds a great deal of flexibility, I think, to have this configured this way. From their staff area, looking out towards the front, that gray area is really clear glass, but it's difficult to render, so it just comes out showing kind of a little bit of gray. And then finally, some modifications over in the law enforcement center. The areas up in the very top, the evidence storage, we've reconfigured a little bit, again, to do less remodeling. And we think it works fairly well. Those two boxes you see right off the lobby are vending machines that will help us sort of cover a new wall that doesn't match necessarily the lobby walls. And then that corridor that leads down there now is basically the evidence storage room, leading down to an evidence lab, and the intake area is all sort of nestled in there and working fairly well. A few structural issues there, but not too many. The entrance off the night entrance to this office area has been moved so that the door can be in the same place as it is now, again, so that we're not disrupting some of those sorts of things. One of the other things I forgot to mention when we were on those slides, however, is the renovation of the main public toilet rooms on the courts level and on the main level off the 1990s lobby. If you remember, there was quite a bit of discussion as to what we might want to do and need to do for handicapped accessibility. And we talked with the Council on Disability and arrived at a solution that is going to have us making 2 toilet stalls out of 3 in the women's and 1 out of 2 in the men's, so that 1 urinal instead of 2 urinals in the men's, so that we have full accessibility in there. But that side jam, as we call it, issue where you need some room on the side to be able to open a door, they're perfectly content with us putting an operator on that door so that anybody that has difficulty doing that kind of maneuver to get that door open will be able to hit the operator and open it up. And so we've arrived at that kind of compromise, a cost-efficient way to get it really fully accessible.
Well, like for the jail upstairs, will they still be able to come through that back door? Or where they come through right now, where they buzz them right upstairs? Or are they gonna have to walk through the very front and all the way around?
After hours visiting will be there for sure. We're
Yeah.
still talking about whether or not we want day entrance into that.
Okay, but after hours
Yep.
would be, okay.
Yeah, and it will be controlled as it is
Yep.
on a weekend.
Because right now it's just right there, they don't need to
Yep.
walk through everything?
Nope,
But
but
if you
they
have-
won't be able to come in this way and walk through the entrance of the building, so it's one of those we have to talk about what we want to do for access during normal business hours.
Okay.
Yeah. Primarily, it's that, the public will come to that waiting area right where you now go
Right.
into motor vehicle. And then finally, we have the issue of this. Under your direction, we're removing it, and at the same time, we need to then do something at each end of this link. First, to create an entrance to a motor vehicle, and then also to create an enclosure somehow at the courthouse. And the desire, obviously, is to not start getting into the stone and the brick of the historic buildings. So what we determined is to leave everything that's colored, it has the cream-colored brick in place, take down the very poor and inefficient aluminum system and the structure that kind of goes with that doesn't meet current codes, and then create a very small vestibule, the outer part of which you see is just glass, some metal-clad portions that will cover the columns on the inside right at the bottom of the stairs. And from the side, it will look something like that, very simple. That flashing that kind of nestles into that arched opening needs to be redone, but left exactly where it is, so it does what it does in the same manner. So we're just carrying that very same line out to create this very simple vestibule, which could prove to be not temporary, but at some point, if that building is restored, then this would very likely be removed. We've got a portion that sort of bumps out over the doors to give you the ability, if you want to sign something there, to be able to put letters above there. And then, because it would be nice to have some similarities between the entrance that's directly opposite. This is the entrance to the motor vehicle department, what will be the motor vehicle department. We don't need to add a vestibule outside because we can save the money and do it internally with another pair of doors. But we would be creating a sort of raised and sign board of sorts that just comes out and provides just a very small canopy drip line at the doors, and then gives you the ability to put the same kind of signage on there in a fashion similar to the kind of signage that we have over the counters on the inside of the building as well. So that was just
We had talked a little bit about, at the outset, access into the historic courthouse. I don't know if any of you were in conversations about whether we put a lift in or something like that at that entranceway to make it more accessible. And it ended up being all the options that we looked at just were not cost effective, and really the access once inside is so limited anyway that the return on investment isn't one that we were comfortable recommending. And so when that, like Steve had said, when that's tackled, it likely makes sense to just tackle it as a whole building instead of piecing it together, spending a lot of money that's going to go to waste in the future. And so there isn't a recommendation right now to modify that. But certainly, as you've gotten feedback from this project as a whole, at some point in time, if the building's addressed, it'll be addressed completely.
So that kind of summarizes where we are. Again, we're much further than those drawings because we've got a whole set of documents now ready to get to Integrity Group. But with that, I would turn it over to Pete to talk a little bit about what's happening in the next month and the next, few months after that.
Yeah, I thought I'd put some dates out. As a matter of fact, walking up here, you get the question, when are we gonna start? So that'd be good to get some dates on paper and just kind of explain to you what you're gonna see here in the next few months. This one here, we are having the ability to do what we call a red line review set. When provided that opportunity, it allows us, in conjunction with Steve's office, to dot the i's and cross the t's and another set of eyes looking at the final documents before a contractor actually sees them. That is basically the only communication that a contractor has, is putting a number together on these documents. And the more clear, concise look we can give them, the better we've had projects turn out. It's just avoids delays during construction, et cetera. So if you look at item 2, that red line review set, like Steve mentioned, they're gonna go back, tighten these drawings up and send them to a printer. We'll issue a few sets out. Like I said, the county will end up with a set here, and then we will have a set. And my brother Mike, who's gonna be the on-site person on this project, will be over here for the next 3-4 weeks, going through these drawings, going through the specifications, from a construction standpoint or construction frame of mind, and actually going through these drawings and reviewing those. At the same time, we kind of put a little bit of a schedule together on when we'd like to bid this project, given our review time. We positioned ourselves for a bid date of the 6th of December. As you're aware, we got to advertise in the legal newspaper X amount of times, and the last ad can't be less than 7 or more than 14 days before the event. So just to keep ourselves straight, we have the dates that the ad needs to get to the record, and the days it'll be published, days that the plans will actually get finalized and sent to the printer. After the bids, we usually take about a week or so to qualify them, sit down with all the low contractors, make sure that they have everything included. We generally put a list of questions together, just make sure that we don't have somebody on board that's not comfortable with their bid or missed something. Just make sure that they understood the whole project completely. We don't want to get them under contract and then we start day 2 with an argument. And then we have slated for the last board meeting in December to bring the bids here for approval. And then start the contract process and hopefully start construction sometime in January of 2018. If you notice, we also have item 12 there, temporary space remodel. So as we're doing our review, we also need to figure out what we're going to do for some temporary office space down in the basement of the 90s building. That's going to be our flex space where we're going to incorporate the people in the 70s building where we're likely to start, this middle section here. Set up some temporary offices, temporary counters, so we make sure that the public is still served during this first phase of construction. So we'll work with Deb and John and the staff members to lay out a temporary floor plan. It's not going to be completely finished space. It'll be just temporary steel stud walls, temp doors and things of that nature. But at the same time, we know that it's going to be used for serving the public, so it's still going to have to be safe and efficient in what we do. Kind of our game plan and still tackling this is we're going to start here in the 70s building, finish that. As I said before, we will displace the people to the 90s building. And then from there, we'll move over to the human services side of things, tackle those 2 floors over there. From there, proceed on to the public health side, because public health, once the human services will be done, will be able to move only once into their new home. Construct that, move the license center over, and then start the sheriff's department. It's a little bit of leapfrogging, but it saves on the moves and tearing everybody apart and creating chaos around here. So we're going to try to do it in somewhat of a systematic order. So at the same time, when this project goes out to bid, we'll have a little bit more of a scheduling plan, phasing plan that's also put out there for the contractors to understand how we're going to tackle this. And it'll start to narrow down some dates as far as how long we expect each phase of this project to be completed in.
So one will be kind of complete. I'm trying to think of air conditioning and heating systems when they have to work, but you're putting new ones in off of the old ones. It sounds complicated.
It is complicated, and that's why this next 3 weeks now we have the final mechanical drawings. That's why I'm just speaking more generalities, but that's how we feel the system will work. At the same time too, once we move people in here, yes, we'll have to have items operational. We aren't gonna do anything with the boilers until next year, so time we get done with this will be in the summer months, but then air conditioning will be a concern before we move people in, so, yep.
Yeah, complicated, sounds like that's a good word, but, you know, well thought out, it's good to have a good team on it. I know staff is, nobody looks forward to living in a remodel situation, it's not easy to do it, but we've got good leadership and hopefully everybody can help really lead staff through it, because I know it's tough. And then making sure we're communicating with the public and making sure we're very transparent on what's happening. We do have some information that we're gonna kind of do a display in the lobby a little bit and start identifying. We have a brochure and a pamphlet and some drawings that we wanna get out to the public, so they kinda understand what the ultimate goal is. I think it's hard to live through something not understanding what we're trying to get to. And so I wanna make sure that we have information available to people that are coming in and visiting us on a regular basis, and making sure we keep that up to date, and making signage as it moves or as things are different busy times and things of that nature that we're addressing those.
If I may, Mr. Chair, security was always an issue. What's our plans for that? Do we have any?
Question. Yep, we've actually, well, we've had a number of different meetings that we've been dealing with. One of those was with, I don't know who those guys are with now, the electrical guys. And then some, about really labeling and figuring out where card reader doors should be placed and how that's accessed. The systems to do that will kind of be throughout this project as we look at different software components with it and how that's done. Cameras, where those will be placed. We've had consultation from the sheriff's office to make sure that they're aware of and offer advice on if they were accessing different areas, what kind of information would they want to know or see. And so we've had a team put together on that to make sure because I don't know those things, but they do. And so we've had good communication with that really established. We had a big plan laid out and we put, pink exits or X's where the secure doors were and green ones where monitors or cameras will be, and then how they're monitored and what systems they funnel into. And so, yes, it is something that we are working with in the constraints and budget constraints that we have. So
One of the key elements of that plan, though, is that doors will be able, if in an emergency, doors will be able to be shut, and they'll come shut automatically. And then people who are not in that zone of the building where there might be a danger can't wander into that area where there might be a danger, but staff using cards can get in there and deal with the dangers. There's some pretty interesting ideas put together. The other thing, to varying degrees, we've closed off the fronts of the public service counters. In some areas, there's not glass above, in some areas there is, but where there is not, at the direction of you folks earlier, we have planned blocking and soffits up above so that you can, in fact, in 5 years from now, if you decide, place more glass in those areas, depending on how functions may change, and it might become more convenient to be able to do that, so.
But the areas that don't have glass, like for example, this land services, recorder's office, auditor, treasurer's floor, doesn't have glass on the counters by request, but it doesn't have open access like it does now,
Right.
where public members can flow in and out. Everything's card accessible. In the high, wider counters that prohibit, just wandering in, really, I think you'll notice if somebody gets in that regard. But we have more control, more limitations. And then after hours, the entire floor is locked down, not the individual, because there's not glass on the front counters and they're not going to be rolling screens, but the entire floor is secured. And then within those offices, there's secured lock components of that, because it's very important to make sure, I'm looking at Eileen, but a certain information needed to be secure beyond just a floor that's secure. So we have other areas that are lockable and only accessible for certain staff that have authorization to be there and stuff. So a lot of different security components built in that are planning for the immediate need, and then future if we are responding, our need to respond in a different way.
And I think the timing of these bids are gonna work out well for the county right now, just with the contractors I've talked to here in the last month, they're starting to look again. So I think, it's that supply and demand, I think some of these prices will drive good competitiveness, so.
Plus they get to work inside for a while during the winter.
You got a quick starting winter project, you bet. That's always a plus.
Yeah.
Sounds good. Does anybody have any other questions?
Mr. Chair, I would like to address the proposed dates. Just set those if you want to approve those so we know that we can move forward with those, that timeline.
The dates that are given, is that what you're talking about?
Yep, the
Deb?
bid dates and the plan for those dates.
You want a
that are-
motion on that?
Yep.
Could
I'll make a motion.
Got a motion by Commissioner Lemire, seconded by
Second.
Commissioner Winchard. Any further discussion on those dates? Not all in favor signify by saying aye.
Aye.
Opposed, motion carries.
Thank you very much.
Thank you.
So that is our
Thanks,
timeline.
Pete.
That is our timeline now.
Deb, can you shoot that copy of those dates to us?
Yes. Can I keep this and I'll get them a copy of it? Okay.
Tabitha, I don't know if you'll be here. Will
Could
you
you
be
shoot
here?
it? She said she's gonna be here for 5 more days.
Look at here, I got something written down here
That
for her.
presentation, save it on our printer, and then get that back to Steve at some point. How's that? This might be a good one to actually get.
Maybe I went.
Thank you.
Thank you, guys.
Okay.
Okay, we got administrators
Yes.
report.
She's saying no chance.
Yep, I need
I
to,
already have all.
And the
these
reason I
dates.
said Deb, because I have your date written down here on the 21st, something's happening, maybe?
Oh, yeah.
It'll be long before the 21st.
Oh, yeah.
Long after?
Okay.
here, I'm trying to get my, here.
To approve the agreement as attached.
Okay, right, first item of action I have is an agreement for that, property down by the Sioux line for Mr. Casella regarding the ability to farm that county-owned property.
So moved.
Got a motion by Commissioner Winchester, seconded by
Second.
Commissioner Johnson. Any further discussion? If not, all in favor signify by saying aye.
Aye.
Opposed? Motion carries.
All right, Mr. Steve.
Then what I have is approved the 2018 preliminary for the HRA. 32.5, same as this year, I guess.
So moved.
Okay, we got a motion by Commissioner Jelinski, seconded by Commissioner Lemire. This is a roll call vote. Commissioner Lemire.
Aye.
Commissioner Winchard.
Aye.
Commissioner Jelinski.
Aye.
Commissioner Johnson.
Aye.
And aye.
The other thing I have is I'd like to get a budget meeting scheduled following a planning session the 31st or whenever it works best for everyone to do that. We could do it immediately following. I'm just going to review I'll be sending that out today, the third quarter report, along with, I believe I already sent out that budget analysis, just to kind of go over with any
1 o'clock
questions
on
on
the
that.
31st? Is that what you're saying?
October 31st.
Maybe even 11 o'clock, right?
Well, it could be if we get out, I don't care.
Yeah.
I mean, it doesn't matter to me. I don't know, sometimes the planning sessions get over
Usually our
earlier.
planning, 8:30, we're usually done by
Do we
11,
have a
generally
meeting with
speaking,
Sam?
right?
No.
What, we have, what's he coming
Delete
in,
it?
probably Bob might be coming in from Lake Shaman.
Yeah.
Well, but
That's,
What do you
2.5
think?
hours,
No, we're not.
No,
11.
11 o'clock.
11
If it's
o'clock
later,
on-
it's
on
later.
the
We could do it
31st.
11, and hopefully it won't take much longer than noon to get you out of here, so.
Good.
11
If it's
a.m. then we'll
longer,
say.
It's longer, it's whatever.
Budget.
Budget.
10:31.
Yep.
how come I?
All right, sounds good, thank you.
Thank you.
The next action item I have is, there's a national conference, National Public Employee Labor Relations Conference. I've gone to the last couple of years. Our policy says if you go out of state, we need that approved. I want to be able to watch for, if you authorize it, watch for cheaper tickets. Beth Hamlin came with me last year, and it's very good information. So the location this year is in South Carolina in April. But like I said, I wanted to make sure that it was, if I can find cheaper tickets, I would do so. So there's some time to do that. It's in the budget.
I'm in favor of it. Do we need a motion?
Motion by
okay.
Commissioner Jelinski, seconded by
Second.
Commissioner Lemire. Is there any further discussion? Not all in favor signify by saying aye.
Aye.
Opposed? Motion carries.
Okay, thank you. The next is Rich Prairie. There, I have, oops. My
Your
fingers-
monitor has something to be desired
No, it's
behind you
me.
too.
To consider the reappointment of Gary, oh, well, that's not me. I don't know.
It's been going off and on
I
all
know,
during
I
the
know.
meetings.
There's something goofy.
Obviously.
To consider reappointing Gary Gangle, Larry Korf, Mark Fighton, Dave Fisher to the Rich Prairie Sewer and Water Board for a 2-year term of 1/1/18 to 12/31/19.
So move.
Got a motion by Commissioner Johnson,
Second.
seconded by Commissioner Lemire. Any further discussion? Not all in favor signify by saying aye.
Aye.
Opposed, motion carries.
To authorize, this is a new one, we had a vacancy, or we have a vacancy that's upcoming in the auditor treasurer's office for the position that works with creating tax parcels and drawing in the mapping system. And so that request went out, and there's been work done to fill that. That has been filled. It's been filled internally. With a person right now that is working in a split position, half-time with motor vehicle, half-time with auditor treasurer's office. When we had that advertisement out there, when we talked to the board and got approval for that, I didn't think at the time to say, and any subsequent vacancies as they may come forward. So at this point in time, the request is to replace the existing staff levels in both areas with a split person, one full-time staff that exists right now, split between motor vehicle and auditor treasurer's office.
And then you'll backfill as it needed,
If
correct?
that would be needed,
Right, yeah, exactly.
yes, I
With
guess
someone
that's
else.
true, with someone else.
I'll move on that.
Got a motion by Commissioner Jelinski, seconded by Commissioner Wincher. Any further discussion? Not all in favor signify by saying aye.
Aye.
Opposed, motion carries.
All right. And that's all I have
Okay,
for action items,
Unless,
anybody has anything for me.
committee reports and upcoming schedule. Let me see here once. Mine's not. Who'd like to go first? Commissioner Johnson?
Sure.
Okay.
What are we talking from the
What dates? are we-
15th,
16th through the 23rd? Yeah. I mean, no, 28th or so. Okay.
21st we got, right? Or we got 28th? You're right, I'm wrong.
Commissioner Wilson and I, on Monday, we have community development at 12:15 at Pine Country instead of on Tuesday. Then on Tuesday, we got planning at 8:30. On Wednesday, Commissioner Wilson and I have a community corrections advisory meeting at 8:15 a.m. I think it's in, I don't know if it's meeting room 1 or whatever. And then that evening at 7 p.m., it's township officers.
And that's gonna be at Little Falls Township Hall this year.
that's
where it's
correct.
gonna be.
Oh, it is?
Yeah,
Yep.
they,
Yep,
yeah.
Little Falls
Yeah.
Township Hall.
Oh, I didn't know that.
You're on what date? What date is that?
That's the 18th on
18th.
Wednesday.
I did talk to Babe just to let you know when I'm bringing information on the remodel, just to give a quick update to that group about what it is we're doing here, and I'll have the pamphlets
Okay,
and that drawing.
okay.
Very
okay.
good.
At Little Falls Township.
Yep.
At 7 o'clock.
That's
Okay.
correct.
Then on the 19th, we have a public hearing on, about a trail at 7 p.m. at the court, supposed meeting room, oh no, it's probably right here in the
Right here.
boardroom. Then on the 20th, I got a Mississippi Headwaters meeting, I think it's at 9 o'clock at Chase on the Lake. And then I think it's 10:30, where it's for the whole board. Whoever wants to come to it that day, it's like a
It's a
annual
biennial
meeting, whatever.
conference. It's the Mississippi Headwaters Board Biennial Conference. I happen to know
Yep.
right about it. It starts for everybody else at 10:15 registration,
Oh.
10:45 it's the
Okay.
start.
Okay.
And it's scheduled to go until 3 p.m. So
Okay.
everybody's invited to that.
Okay, then on Monday, the 23rd, we got a District 5 meeting in Chisago City at, I think it's 8 o'clock in the morning.
So
Planning and
actually,
zoning-
it's at Center City, not.
Oh, I'm sorry,
Chisago
Center,
County.
Chisago, yep, Center City, Chisago County.
Right.
There, you're right, Center City.
Lots of
And
cities.
then 7 o'clock in the evening, we got planning and zoning here. We got board on the 24th. I have a Region 5 meeting at 5:30 at Joint Powers in Staples on the 26th. That's all I have.
Okay, Jeff. Commissioner Jelinski.
Starting on the 16th, that's good, that's good. On the 18th, I've got a Hands of Hope meeting, but I won't be attending that because of the township meeting.
So cross it off.
Pardon me?
Can't, like, you're.
Yep,
Something
but
to
I won't be
advertise it?
going to that
Okay.
one. On the 19th at 10 o'clock in the morning, I've got an Armor Owners and Operators meeting in Alexandria. There's also an Egg Society meeting that evening that I won't be attending. District meeting. On the 23rd, got extension at 5:30 here at the courthouse. And
Is there a stand-up for you that night?
there's stand-up for you at 5, so I won't be making that either.
And then I have an Armor Regional Leadership DOT, is that you, on the 23rd?
There's plenty.
Regional leadership on the 23rd?
I have it on here, but let me.
I don't have that.
Okay.
I don't think so. On the 25th, I've got an NJPA conference in Staples.
R5 Summit?
Yeah,
Yeah.
I'm planning on attending that. On the 26th, disregard.
So the SECB meetings, you're not going to?
Yeah, I'm not gonna make that.
Okay.
And that's it, I guess, right? I think.
Mike, it's always good to be at the end of this.
Yeah.
These two do a good
Or do lap.
job. Commissioner Wincher.
Right, one of them.
Yeah, well, I won't say it, I forget it. I'll let you say it.
No.
Okay, I got Great River on the 17th at 6 PM. I'll let him take it. TCC at 4:30 on the 19th. And I don't know, help me out on the 21st again, Tabitha. I don't know, there's some special date, whatever that is.
Saturday?
Doesn't need to be
It's
advertised.
a Saturday.
What is that? It says Tabitha due date, I think.
That's it on there.
We don't all have to be there. It's not a
No.
public meeting.
That's right,
You're not
that's
invited.
right.
All right, and then on the 26th, soil and water at 9 o'clock.
Hey, Commissioner Lemire.
Public Health on the 25th at 5 p.m. And Deb, can I get a set of them plans?
Yes,
'Cause
I'm
they were
going to
asking
have
about
all
it
of those
last night,
sent
too.
to you guys, and I actually think I'm gonna put it on the internet.
That'd be good.
They'd like to see that.
Internet would be good too.
Oh, yeah, yep,
And I can't make that 18th meeting with the townships.
okay.
I'm gonna be out of town.
And I have Airport Commission on the 19th at noon.
Yep.
Otherwise, I think everything's been covered.
Just a couple updates that I forgot about. I will be out the 19th through the 23rd.
Yes, that's possible.
So I won't be at that public hearing for the trails, but I'll make sure Steve has what
Yeah,
he
it
needs
is,
for that.
it is.
And then there's
There's a
something
pack.
else
Do-
that's going on.
It must
Do we
be
need
MEA.
somebody that night, Deb? I don't mean to put you, but somebody took notes for that last night,
Computer's
so
not doing stuff.
will Steve bring somebody
Get a new-
for
We'll
that
figure
19th?
that-
I don't care.
And last night wasn't actually a public hearing that we did, but we wanna keep track of it otherwise, so I will.
That's
let-
the only reason I make that
I'm
comment.
letting Steve know I'm not gonna be there, and we'll figure out what needs
Okay,
to happen.
all right.
This is just about 7.
Yeah, so I'll
That's
be
just-
gone those
yeah, that's
couple
all
of
that
days.
was gonna be.
There's a test, because I'm sure.
That's trade,
Okay,
November.
is that all we have?
Yeah, I think,
Anything
yes,
else?
you're right.
I would so move for adjournment.
I got a motion to adjourn, second.
Second.
All in favor, signify by saying aye.
Aye.
Opposed, and stay.